I think that's a bit wide of the question. We now move on to the next item of business, which is a debate on motion number 4778 in the name of Alec Neil on universal benefits. Members who wish to speak in the debate should press the request to speak button now. I call on Alec Neil to speak to move the motion. Cabinet Secretary, you've got 14 minutes.
Very much indeed, Presiding Officer, and congratulations on your appointment to the Privy Council. I'm sure everybody in here shares that congratulations. Presiding Officer, this debate centres on the universal services and benefits that support the health and well-being of the people of Scotland. This includes progress that's been made by parties from across this chamber under devolution, including the delivery of free personal and nursing care for our older people, the abolition of free prescriptions for all, of prescription charges for all, the entitlement to free eye examinations for all, and the National Concessionary Travel Scheme for older and disabled people. And, of course, the unswerving commitment to having the National Health Service in Scotland that is free at the point of need and kept in public hands, unlike down south. These policies form the bedrock of supporting Scots to lead healthy and independent lives. And until recently, I thought that nearly everyone in this chamber shared that view. Prescriptions. It cannot be right to tax ill health through charging for prescriptions, an approach that could force some in our society to sacrifice their health as they look to balance their weekly budgets. Securing the visual health of Scotland means keeping eye examinations free for all. Examinations which have long since moved beyond a simple eye test and enable an assessment of a patient's entire visual health. I'm convinced of the benefits of eye examinations and the role they have in supporting the people of Scotland to manage their wider health and well-being. Of course.
I'm grateful to the Cabinet Secretary for giving way. I wonder if he could explain why we are returning to this issue when we debated it just a few weeks ago. Is it because the SNP took such a hammering in that debate that they've now come back for round two?
Cabinet Secretary.
Presiding Officer, the simple answer to that question is no, we didn't take a hammering. For an older generation, I'm convinced that helping people to be independent and living at home for as long as is appropriate is an important part of helping older people to continue to live active and fulfilling lives.
Jan Lamont.
Does the Minister think it's acceptable that the level of care an elderly person receives to be sustained in their own home is a 15-minute visit when the carer is told, task and go?
Cabinet Secretary.
Presiding Officer, I'll come to these points later in my speech, but I think that free personal care is something which Labour and the Liberal Democrats introduced, and I'm surprised they're now thinking about scrapping it. As far as concessionary fares are concerned, it must also be right to continue to help our older people and those with disabilities, including disabled veterans, through the concessionary travel scheme to get about using bus services and for residents in our Northern and Western Isles, ferries to and from the mainland. Supporting active and healthy lives by allowing people throughout Scotland to be able to access services, meet friends and families, and enjoy a fuller participation in society without being constrained by the financial cost is the right thing to do. I'll let Gavin Brown in.
Gavin Brown.
I'm grateful to the Cabinet Secretary for giving way. Does he accept, though, that some of the expenditure on concessionary travel is deadweight expenditure?
Cabinet Secretary.
Presiding Officer, if he means that somebody like Fred Goodwin might get a bus pass, although I doubt that he would use it, my argument is let Fred Goodwin get the bus pass as long as he's paying for it through much higher taxation to help pay for it for everybody. The fact that Fred Goodwin gets it is no reason to scrap it for those who need it, which is what the Tory philosophy would be. I'll make another intervention. I'm glad I'm so popular.
What is your estimate on the comparative benefit of a council tax freeze to Fred Goodwin as opposed to somebody in a Band-Aid house in my constituency?
Cabinet Secretary.
The party supported the council tax freeze. They tried to outbid us with the council tax freeze. And now, like everything else, as Arthur Blake Midwinter said, everything's on the table. And I wonder even if under Labour scenario, people will have to pay to visit their GP if nothing is off the table. So let's look at the facts, Presiding Officer. Let's look at the facts on free personal care introduced by Henry McLeish as First Minister. Last year, this provided a valuable and hugely beneficial service to over 30,000 older people in care homes, and over the last couple of years to around 46,000 older people in their own homes. The free personal and nursing care policy has often and rightly been held up as a real success of this Parliament, and one of the distinctive policies of devolution, supported on all sides of the chamber. It provides valuable support to thousands of older people in their own homes and in care homes. Christine Graham.
Christine Graham.
Thank you, Cabinet Secretary. Having mentioned Henry McLeish, and indeed I'm going to mention Jack McConnell, both tried to get the attendance allowance, which was saved to the DWP by the introduction of free personal care, returned by Westminster and failed. The last time I knew it was £40 million per annum. Do you not think that's disgraceful that money is retained by the DWP?
Cabinet Secretary.
Absolutely, Presiding Officer. I was actually going to make the point myself. The DWP has retained around £300 million. And in fact, it was Alistair Darling, who was a minister, that robbed this Parliament of that money. You may remember when he was Secretary of State for Social Security. And with that removed eligibility for some older people to attendance allowance. Now, we've heard in the past from experts such as Professor David Bell, in an Economist article in August 2010, he said that since free personal care was introduced by the Scottish Government in 2002-03, the number of long-stay geriatric beds in Scottish hospitals has fallen from about 2,700 to 1,700. He believes this represents a greater saving to the National Health Service than the extra cost of free personal care. In other words, it not only makes humanitarian sense and makes health care sense, it makes economic sense to have free personal care for our older population. Of course, Duncan.
Duncan McNeill.
Secretary, accept that we all support that policy. It's about how we pay for that policy. And does he believe that a regressive pay freeze shouldn't be subsidising free personal care?
Cabinet Secretary.
This is the pay freeze that Ed Balls supports, but can I say it's not clear any longer that you all support free personal care? That's the whole point. It would appear that you do not any longer support free personal care in the Labour Party. In terms of eye test, Presiding Officer, in 2006, as a result of in part the work of this Parliament, the previous NHS eye test was replaced by a comprehensive eye examination. This extended service delivered 1.9 million eye examinations last year alone, an increase of almost 1 million assessments on the number of NHS eye tests in 2005-06. I think we should be proud of that fact that's enabled such a significant increase in the number of examinations, whilst also extending sustainably the content and value of the service. And the rationale behind the policy has long been the recognition that eye examinations will diagnose conditions that may previously have gone untreated, and that by early diagnosis, more complex or long-term problems can be avoided fully or in part. The funding of the general ophthalmic... Yes, I will.
Dennis Robertson.
Thank you. Thank you, Presiding Officer. Thank the Cabinet Secretary. It's more than just eye tests, Cabinet Secretary, and the diagnosis of. It's actually to do with well-being. But would the Cabinet Secretary realise that the money spent has been actually preventative save? because people are early diagnosed to go straight to the hospital rather than waiting weeks or even months with a referral by their GP.
Cabinet Secretary.
Officer, that's a point very well made by my colleague. The funding of the general
Pat, I wholeheartedly agree with the Minister on eye checks. I think it's a very valuable investment. But can I just return on to the motion where it says the only way that these universal services and benefits can be protected and maintained is through independence for Scotland. If the SNP lose the referendum, what happens to universal benefits?
That's actually a very good question, because far from being better together, we would be a lot poorer together if we vote no in the referendum. And I certainly won't be taking any lessons from a Liberal Democrat supporting a Tory-led government with all the cuts they're imposing and the destruction of the National Health Service they're engaged in south of the border. Let me return to eye tests, Presiding Officer. The funding of the General Ophthalmic Service to run the free eye examination programme is currently around £70 million a year. This funding covers the previous NHS eye test programme and the extension of the new programme. The benefit of eye examinations can be substantial, as I've already said, and recent research published by the Association of Optometrists this year proposed that the increase in eye examinations could realise an initial annual benefit of around £400 million. That's for a spend of £70 million, as Mr Robertson was saying, preventive spending. The report also suggests that the benefit accrued amongst those people who previously were not eligible could see an initial annual benefit to them of around £40 million. So those who oppose eye tests, I believe again, are not only getting the health argument wrong, they're getting their economics wrong as well. Now, in concessionary travel, I haven't let Jackie Bailey in so far, and I couldn't go through this debate, Presiding
Jackie
Officer,
Bailey,
without getting, no doubt, a constructive contribution
Jackie Bailey.
I have never had such a long and insincere welcome, Presiding Officer, but I thank the Cabinet Secretary for that. I wonder whether I could genuinely ask him to comment on accepting what he says about eye tests. Does he agree, therefore, that means testing optical vouchers is a barrier that is in place to people receiving the kind of treatment he's just described?
I think it's rather rich of Jackie Bailey to complain about that when she's thinking of getting rid of the eye test, because that's clearly on Arthur Midwinter's agenda. He said nothing is off the table. That means free eye tests are on the table, the abolition thereof. Let me come now to free concessionary travel, because that's not only a transport policy, it's also a health policy. In 2006, the National Concessionary Travel Scheme for Older and Disabled People was introduced. This now provides concessionary travel to 1.2 million older and disabled people across Scotland, including disabled veterans. I can't take any more. Many of these people would face significant obstacles in their day-to-day life if this service was removed, as proposed by some. This impact would be felt in their broader quality of life, their opportunity to access other services, including, let's not forget, important health services, and the positive impact on health and well-being. Presiding Officer, the idea that you would deny people of an older age the ability to travel with the concessionary fares and see their friends and family is beyond belief in a civilised society. Similarly, with prescription charges, the cost of offsetting prescription charges, which this government abolished, was £57 million last year. That is under 5% of the total budget spent on prescribing and less than 0.5% of the entire health budget. The previous approach to charging meant that an estimated 600,000 adults in households with an annual income of less than £16,000 would have been liable to pay for their prescriptions. This would have meant a very real and difficult decision to be taken by many people regarding how they fund their medicines and their spending on other basic provisions and services. The First Minister for Wales, the Labour First Minister for Wales, Carwyn Jones put it very well. When questioned on free prescriptions last month, he said, "We believe it's important that we have an NHS that's free at the point of delivery. We are not going to change the policy on free prescriptions." Policies he is so committed to that he stated that both free prescriptions and concessionary travel will be in the Welsh Labour manifesto for the next Welsh Assembly elections in 2016. Why can Joanne Lamont not tell us today she will make a similar commitment on behalf of the Labour Party in Scotland for 2016? Presiding Officer, let me say this. There has been reference made to something for nothing. When you look at the older generation in particular, who benefit from concessionary fares, who benefit from free personal nurse and nursing care, to say that is something for nothing is absurd. Not only have they worked all their days, and we have a moral duty to look after them in their twilight years, but these people still pay taxes. Many of them still pay income tax. Some may pay other taxes. Every one of them will pay value-added tax. So if they are contributing to our society, why do we not look after them? Why should we not make sure that they are properly looked after? That is the mark of a civilised society. One that Nye Bevan 60 years ago, one that John Smith up until his premature death, all promoted and all believed in. So what this is about, Presiding Officer, is ensuring that we maintain our social contract with the people, and we will maintain these universal free benefits for all our people in the years to come.
I now call on Joanne Lamont to speak to a move amendment number 4778.4. Ms Lamont, you've got 10 minutes, but if you take interventions, we will compensate you.
Thank you very much, Presiding Officer. Can I say, first of all, I'm the leader of the Scottish Labour Party, and the priorities of the Labour Party will be to meet the needs of the people of Scotland. And if the Minister wants to reflect on what the Welsh Labour Party is doing, he may reflect that they actually do not have free tuition. They are making different choices, and they are persuading people on that basis. Now, I do think that the Minister has to confront a simple thing in this debate. That is not that there are good policies, but they are about the competing demands and the gap between rhetoric and reality in our communities. Because 2 months ago I called for a debate about what Scotland's priorities should be, and that debate was endorsed by leading public finance experts concerned at the lack of action by government in the face of the worst financial crisis for a generation. Whether it was Crawford Beveridge, the chair of the First Minister's Council of Economic Advisers, or Robert Black, the former Auditor-General, or Bill Howitt, the former Chief Executive of Western Isles Council, who chaired the independent review of Scottish executive spending, they agreed there was urgent need for a serious debate. And frankly, to suggest that the Minister is the only one in here concerned about older people, the only one concerned about National Health Service, the only one concerned about concessionary travel, simply does not serve the people of this country well. There is a serious debate to be had, but of course the SNP did not want that debate. First, they tried to close the debate down through a mixture of name-calling, denial, distortion and outright falsehoods. They failed. Ministers failed to debate in public, and I am disappointed that John Swinney still refuses to be engaged in this debate, despite the fact that in commissioning Beveridge and Christie, he acknowledged there was a debate to be had. So when I heard the SNP had called for this debate today, I had hoped that they had now been forced to address these issues which concern the hard-working people up and down the country. But given what has been said and given the motion, it's clear we are not there yet. It's clear that they are only capable of viewing this through the prism of the referendum, and this is yet another proxy debate for independence. Last year, the Christie Commission report, I'll make this point, Last year, the Christie Commission report said contentious issues such as the continuation of universal entitlements must be considered openly and transparently rather than in the current polarised terms. What we have is a debate between competing good things, not between a compassionate minister and someone he alleges now is going to ask people to be paid for their visits to the GP. It is a diminution and a distortion of that debate for him to conduct it in those terms. Because today's statement by the
Cabinet Secretary. Presiding Officer, every time the member speaks on this, she calls for a debate, but she's still to tell us what her policy is. Is our policy to keep free prescriptions, yes or no? Is our policy to keep free eye tests, free personal care? Or is our policy to charge for these items? Tell us what our policy is.
If the Minister refuses to listen, what we're saying is there are good policies. Let us look at the cost of these, the benefit of them and the opportunity cost. No, you haven't, and I'll tell you why. You say in free personal care is important to sustain people in their own homes. I'm telling you, the reality is old people are being contained in their own homes with 15-minute visits, tucked up in their beds at 6 o'clock, and the carer told, focus on task and not the individual. That is not free personal care, that is a slogan. Now, we know that this is not an easy debate to have. The easy option for me would have been to sit back and pick off the government when they made difficult decisions. But I care too much about Scotland for that. Because the fact of the matter is, the debate I called for is not about universality versus means testing. It is about what we can and cannot afford. It is about what is sustainable in the long term. It is about priorities and choices. And it's about engaging the Scottish people as adults. If we choose to spend money on one thing, we cannot spend it on something else. And for too long, we've been happy to tick the box, ignoring the connection between the soundbite and the delivery of policy. And indeed, that gap is widening. Because the Minister says what you need to do is increase taxation. But the Scottish Government, every time they see a tax, they cut it. The council tax, the underfunded council tax freeze, disproportionately benefits Fred Goodwin and not the poorest people in our communities. It is self-evident if you have got... McDonald, this will be good.
It will be. I have a pensioner couple who live next door to me who are living in a house which is exactly the same band of council tax. I could probably afford to pay a several £100 hike in my council tax, but they couldn't. Why would it be fair for them to have to face that?
John Lemon.
So you make no benefit to them, you get the benefit and they feel good about you getting a benefit. That doesn't make any sense. I had realised... Everyone knows that a council tax freeze disproportionately benefits people who are better off, and when it's underfunded, people then pay in terms of public services as well. We know there's an issue about the council tax and its unfairness, but if it's regressive, by definition, a council tax freeze is also regressive. And if we have a policy, we have to face up to the consequence of the policy decisions we are making, asking ourselves if they are still delivered to the standards we expect, and we are right to prioritise them over other areas now under attack. We have a policy commitment by the Government to free university tuition fees, free prescriptions, free concession travel and free personal care for the elderly. But the contention, of course, none of these things are free. The truth is, the cost comes from somewhere else in the budget, and that is about budget choices, not about cuts. We know there are huge costs in terms of free personal care, in terms of prescriptions, in terms of health and social care, in terms of travel concessions. All of these things, if you listen to this, all of these things are desirable. But the truth is, if you want to keep these services, you'll have to be honest about how they are funded. If you don't, then you have a cynical slogan and not a policy. The Scottish Government often talks of its balanced budget, but the reality is it's a fixed budget, so every pound that goes on these things is a pound less for other public services. Now, it could be that the SNP government has got its priorities right, but the idea that we cannot debate those
I don't think the
priorities is an outrage. And indeed, I would have been happy to engage with the First Minister, the Finance Minister and other ministers to talk about the real world and what are the real things that actually matter and what are the ones that are more important than others. That didn't happen.
Joe Fitzpatrick.
Intervention. On the point of priorities, does the member think that the £350 million that's been prioritised for a new Trident could be better spent?
Joanne Lamont.
Well, of course, we do know that the SNP's position is to spend all of the money on Trident on defence. So it's not about providing services. And I am more than happy to test any public spending commitment against the benefits it has to the people of this country. But what we have in the SNP, earlier last week, the First Minister denying the Auditor-General's position on the health service being an amber warning, denying that a further education sector. We're not even allowed to say they've got cuts. Never mind have a serious debate about the impact of them. We know that it's hurting people now. The First Minister chooses to slash funding for colleges. This has helped lead to 70,000 fewer students studying at our colleges. Thousands of college places have been sacrificed just so that he can claim university tuition is free. That is not fair. It is not a progressive beacon, and I think it is wrong. Now, maybe the First Minister has got it right, but then he should make the argument, present his evidence that investing in university tuition fees is better for the economy and for fairness than investing in our colleges, and then at least we can have the argument. He says there is no such choice being made, but we know across the country that those choices are being made.
Maureen Watt.
Will the member realise that today we have seen that south of the border, the fact that there are tuition fees has increased the rate of inflation, which affects everybody?
Joanne Lamont.
But the price being borne by that is not by nobody, it's being borne by every young person who wants a college place, every young person sitting in a waiting list, and every person who, having lost their jobs, cannot retrain. And the fundamental insult is they're not even being allowed to say that it's a government choice that it is happening, that it's happening by accident somewhere. If you make that choice, then at least have the courage to face up to the consequences and explain to people why you're doing that. The fact of the matter is, only 2 years ago, John Swinney was keen for us in the public to have, quote, the widest possible debate about the range of options contained in Crawford Beveridge's review. What they need to understand, this is not about parliamentary knockabout between me and Alec Neil and the First Minister. It's not about degrading people's positions. It is genuinely about saying, if you want good public services that people can rely on, that our older people are not isolated and in fear, we need to stop sloganising and start working together about the consequences of the decisions that are being made. The SNP have forced students to top up their budgets with loans by cutting college bursaries by £900. Those with the most limited means are now financing the best off. These are the First Minister's values. They are not my values. The reality is, this government pretends they are not making choices. They are. They are choosing to pretend they have free personal care when we have elderly people vulnerable in their homes. We are pretending we've got free education when we are denied college places, and in our schools our young people are being denied the basics to learn. There are very important issues here about the quality of services, about the importance of protecting vulnerable people. We will do none of these things if we settle for the approach of the SNP government, which is to pretend, in denial in the face of the reality that everyone across this country knows, that we have a fixed budget, we have choices to make, and the test of these choices has to be about fairness, about equality, and ensuring that those who are most vulnerable get the services they need and deserve. I move the amendment in my name.
I now call on Gavin Brown to speak to and move Amendment 4778.3. Mr Brown, you've got 7 minutes.
Thank you, Presiding Officer. The debate over universal services cannot be ignored any longer. We have the convergence of two critical factors: weakened public finances and the demographics of an ageing population. In the short to medium term, we have to focus specifically on the weakened public finances. When many of the universal services that the Cabinet Secretary mentioned came into being, we as a country were awash with cash. In some cases, we quite literally couldn't spend it and built up about £1 billion in terms of end-year flexibility. But in an era of declining budgets, it's a very different game, and we have to make choices and focus on priorities. Audit Scotland said that in 2009-10, the combined cost of free personal care, eye tests and travel costs were around £870 million and rising. So in these very difficult times, I think the expression put by Margaret MacDonald, the expression put by Margaret MacDonald that we have to look to see how we can cut our coat according to our cloth is absolutely right. I'll take an intervention from the Cabinet Secretary.
I thank the member for taking an intervention. He mentions how much these cost in terms of expenditure, but he hasn't looked at the other side of the balance sheet, which is how much they save. I've already said the free eye test costs £70 million, but generate £400 million worth of benefit. If you don't spend the 70, you don't get the 400.
Captain Brown.
It's not fair at all to say we're not looking at the other side of it all. I think it's extremely important, as the Christie Commission said, to look at both the costs and the benefits, and not just to look at whether it is good value for money, but to look at whether it is optimal value for money, because if we spend it on one thing, we cannot spend it on another, and there is potentially an opportunity cost. Now, this side of the chamber do not dismiss eye tests at all, but I should point out to the Minister, in the very paper he quoted from the Association of Optometrists on page 1 of the executive summary, it does say quite clearly, it is difficult to calculate the value for money from NHS-funded eye examinations, as health improvements will not be fully felt for many years. Now, that is not to dismiss eye tests at all, but I do gently point out that it is a debate to be had about universal services, and the points that he makes are simply not exactly correct. On concessionary travel, because he mentioned that too, the point was made, I think, quite rightly by the previous Auditor General, Robert Black, who said the cost of providing free transport to people who are over 60 and still in employment is £34 million or so. And he said that is deadweight expenditure if ever I saw it. So it's not just a debate simply about whether you should have concessionary travel or not. It's a big debate about the terms on which you have it. Could you make it, for example, age 65? Could it be people who are in work and over the age of 60 don't get concessionary travel until they hit the age of 65? That would save £34 million, Presiding Officer, which is not to be sneezed at in the current position we find ourselves. Not at this time. The second point, though, in relation to the challenges we face are the demographics. In the medium to long term, we have an ageing population in line with almost all developed countries. This leads to a greater demand for services, and these will inevitably cost more. Between 2008 and 2033, the number of people aged 75 or above will double, Presiding Officer. That cannot be ignored by this chamber or indeed any other part of Scotland. Not at this point. Let me develop this just for a moment. It's interesting, on concluding on universal services, Professor David Bell, who was quoted by Alex Neil in support of his argument just earlier on in the debate, said this: the reductions in the budget that are in train imply that avoiding the question on universal services is no longer tenable. Now, that was what Professor Bell said in 2010, yet in 2012 we have an SNP government refusing to even have the debate to open up the books and let us look carefully, one by one, at costs and benefits. Now, let me just turn to another point in the motion which Mr Neil was very keen to avoid, but which Willie Rennie, I have to say, helpfully mentioned in his intervention. The part about the government motion regarding independence, Presiding Officer, is downright whimsical. The reality is that the debate around universal services has to take place regardless of whether we separate or not, because, as I said, it is driven primarily by the demographics of the country. Now, we've heard it all now in this chamber, Presiding Officer: more public spending in a separate Scotland, milk and honey for all, lower taxes for all. Today it was higher taxes for all from Alex Neil. But now people will not get older in a separate Scotland, Presiding Officer. Under the SNP, we will all remain at exactly the same age. Now, in fairness, to be fair, Alex Neil looks younger just about every time I see him. So oil of Ole may work for him, but for the country as a whole, it's an absurd proposition to suggest that we don't actually have to address it if we become an independent or separate Scotland. Mr MacDonald really ought to quit while he's behind, Presiding Officer. I invite him to sit down and take his rightful place. Now, the final part of our own motion, which we wanted to focus on, is this. We believe there should be a debate. But in order to have a sensible and informed and measured debate on this critical subject, the forecasts have to be published. As Christie suggested, as Joanne Lamont mentioned in her speech, it has to take place in a non-polarised, transparent environment. So our amendment closes quite clearly with a plea for the government to publish the forecast for spending on universal services for each of the next 10 years. Now, this ought to be possible because they were able to give 4-year figures to the independent budget review in 2010. Give us 10-year figures so that all of us in this chamber, even with differing views, can take a far more strategic, long-term view on the issue. I wrote to the Cabinet Secretary to ask for this, and I was told this: the Scottish Government has no current plans to publish information in this form. And the question I leave this Cabinet Secretary with today is this. Are you not publishing the information because you simply don't have it, because you simply don't know? Or are you not publishing it because you do know and you don't want people in this chamber to see the figures? Presiding Officer, let the government answer this in their closing speeches so that we can have an informed debate, and I close by moving the amendment in my name. Thank you.
We now move to the open debate. The speeches are 6 minutes, but we have some time in hand at this stage in the debate, so if members take interventions, we will do our best to make sure that you're compensated for that. I call Aileen MacLeod to be followed by Duncan McNeill.
Presiding Officer, I am pleased and genuinely proud to speak in support of the Scottish Government's motion on universal benefits in this afternoon's debate. And I'm proud, first and foremost, because it underlines the absolute determination of Scotland's SNP Government to continue to protect the interests of the most vulnerable and disadvantaged in our society during these very tough economic times. And it is precisely during these extremely difficult times that the people of Scotland need to be confident that the Government is working for them insofar as the current devolution setup allows it to, in delivering policies that protect the vulnerable and promote the social justice agenda in Scotland. And let there be no doubt that social justice agenda is now under attack from our political opponents in this Parliament. Their targets are the range of universal benefits that this Parliament has supported from the earliest days of devolution, in terms of our free prescriptions, our free eye examinations, our free personal and nursing care and concessionary travel. Presiding Officer, the universal benefits which the SNP Government will continue to deliver, despite these attacks, are not only measures to deliver social justice and promote social inclusion in Scotland, they also contribute massively to reducing the long-term costs of health and social care that otherwise would arise. And in the report produced in June 2011 by the late and very much missed Campbell Christie, one of the 4 principles that his commission endorsed was to prioritise expenditure on public services that prevent negative outcomes from arising. Measures such as free eye examinations, free prescriptions, free personal care, each makes a vital contribution to the preventative agenda which the Christie Commission endorsed and which this Government is committed to implementing. For example, abolishing prescription charges, let me develop this point, was one of the key policies introduced by the SNP Government in 2007. And in a parliamentary answer that I received yesterday from the Health Secretary, Alex Neil confirmed that prior to the SNP abolishing prescription charges in April 2011, Long-term conditions including Parkinson's disease, asthma, cancer, multiple sclerosis, HIV, amongst others, did not entitle people to free prescriptions. So the Scottish Labour Party therefore think that the estimated 254,000 people that went to their doctor for asthma in 2010 are getting something for nothing, or the 4,162 HIV sufferers, or the 145,746 people who were diagnosed with cancer between 2006 and 2010. No thanks. Presiding Officer, the proposal that Scotland should return to a regime of means testing to determine eligibility for these public services is, in my view, totally unacceptable. Such a policy would have a disastrous impact on hundreds of thousands of ordinary Scots who are already experiencing immense financial hardship as the economy struggles to recover. It will deepen divisions in our society between the haves and the have-nots, and will inevitably lead to growing resentment between those required to pay for these services and those whose means fall beneath some arbitrary level. It will lead to the stigmatisation of the elderly, the vulnerable and the disadvantaged in our communities, and it will impose what is an utterly obscene health and welfare tax on all citizens of Scotland, including the hundreds of thousands who have spent their working lives paying taxes so that they might enjoy a modest level of comfort in later life. No thanks. These people are not living in a something-for-nothing society. They have spent their lives building our society. And means testing, it will add to costs. Administering means-tested systems will require new departments, new civil servants, new bureaucracies. It will create anomalies and confusion about entitlements. It will dissuade citizens from seeking early diagnosis of illness for fear of the costs that they will have to meet for medication. And it will lead to a two-tier system of care as those with higher incomes squeeze out those unable to self-finance their health and care needs as they get older. Presiding Officer, this Scottish Government has entered into a social contract with the people of Scotland, and the universal provision of the benefits I have discussed is a central plank in that social contract. But social contracts cannot simply be comprised of fine words and good intentions. They must have substance at their core, and that substance for this Government is the real policies of universal provision of public services by which it honours its commitment to social justice. And sadly, this is a commitment that no other party in this Parliament can claim to uphold or deliver, and with which no other party, particularly the Scottish Labour Party, can be trusted. And over the next 2 years, the people of Scotland will reflect on their constitutional future. And it is increasingly clear that the choice will be between an independent Scotland armed with the economic powers that we need to create a society that has a commitment to social justice at its heart on the one hand, and on the other hand, a Scotland harnessed to a London-based Tory or Labour government determined to dismantle the welfare state north as well as south of the border as they chase the votes of a mythical Middle England whose government appears to have given up entirely on the principles of social justice and social inclusion. Presiding Officer, I believe that Scotland will choose independence over what is an increasingly impoverished political union. And I also believe that Scotland will continue to choose the SNP over what is an absolute impoverished Scottish Labour Party. I support the Government's motion.
I now call Duncan McNeill to be followed by Bob Doris.
Thank you, Deputy Presiding Officer. Been around as long as many others, not as many as there used to be. We were around for some of those debates, and obviously we believed in what we were doing at that point in time, particularly in and around supporting people in elderly care. There is no doubt about that. But to take that leap and over that period of time, I don't remember the great debate about the Scottish welfare system over those years. It's not about that. We're talking about a short-term crisis here. But I recall in many of these policies that have been lauded here this morning and debated, came about, call me a cynic if you like, came about partly as a result of political wheeling and dealing, rather than sound cost benefits to people who were receiving them. Or indeed creating clear objectives and creating a better Scotland. They were about sometimes coalition politics. So we could extend the free travel that was already happening in Fife and Strathclyde to the whole of Scotland. We also were very anxious at that time to be different from down south. So sometimes these policies were reactions to what was happening elsewhere. And of course, politicians, as we are, we all like nuggets in the manifesto, don't we? And we all had our offers to people there to harvest their votes. So let's get it into perspective. You know, this is not a debate about the Scottish welfare system. Never has been. At that time, we thought it would be a good idea, of course, to extend that free travel, being locally delivered in places like Strathclyde and Fife, as I've already mentioned. And we also, for good measure, made it available to everybody 60 and over. Did we really believe at that time that 20% of those people, and I'm saying we, because we did it, we done most of that, that 20% of people who have, by your own figures, Bruce Crawford, 20% of those who are entitled to a card use it to travel to work. Is that what we intended? And of course, the unintended consequence of that, of course, is the lowest paid workers in Scotland have faced increasing costs to travel to work because the scheme is not being funded as it should be. The principle, yes, Christine, briefly.
Christine Graham.
Christine Graham.
Thank you. On a sort of sideways point to that, would you accept that subsidies to buses, whether it's pensioners going on or disabled or so on, keep the buses running? And that if those subsidies were not provided, some of the bus services simply wouldn't be there, whether or not you're travelling to work.
Yeah. I think I mentioned this. The scheme has not been funded. Ask SNP candidates in Inverclyde who have some knowledge of the bus system, who protested loudly that was not being done. Who would have thought, when we put in place support for elderly care, that would be at the cost of quality? Where care workers go in to pensioners' homes and don't even take their coats off. Don't give them eye contact. That's not quality, and the expense of the system should not do that. And who would have thought, as the Health Committee have the Health Committee have discovered, that free personal care is being subsidised by a wage freeze and the pushing down of wages of workers in that field. I see Alec Neil coming on his feet, and of course I accept his intervention.
Alec Neil.
Member for taking intervention. Even if that is a widespread problem about carers not having enough time with the people they're caring for, surely the abolition of free personal care is not the way to solve that problem.
Duncan McNeill.
There is nobody in this chamber, Cabinet Secretary, that doesn't recognise the need to support our elderly people in the community, more appropriate in the community. We all agree with that. There's no difference. But there's a difference between whether the commitment is there to ensure that that's funded properly and the outcomes are what we would want for our own parents. And that should be the test. Who would have believed, more recently, that free tuition fees are to be paid by those who are striving to get a university? What an irony. It's time to acknowledge, if we do nothing else, it's time to acknowledge that we didn't get it right in times of plenty. Campbell Christie, the words are crystal clear. Alongside a decade of growth in public spending, inequalities have grown too. Between the highest and the lowest achievers at school, between life expectancy and health of the richest and the poorest, and between static wages, and this is Campbell Christie, you've all been lauding them, and the wages of the lowest paid and the booming bonuses of the highest in our public services have somehow failed to make our country fairer. We have a clear responsibility, a bigger responsibility to get this right in hard times. In this side of the chamber, it's that cause that motivates us, to get a fairer Scotland that's sharing the burden. In the face of the biggest public finance crisis since the Second World War, says Beveridge, for those who value public service, we cannot allow our public services and the quality and the standing they have in the community to ebb away. At a time of disinvestment, it's even more important to plan that disinvestment. It's up to us, Scotland's policymakers, as the Joseph Rowntree Foundation has said, to ensure social justice and sustainable economic growth. The real test will be achieving fairness in the midst of cuts. In the end, I'm coming now, deciding how to cut spending and who should take more of the strain is even more important than deciding how much. It is a reality check for devolution and a chance to prove the new reality matches the rhetoric. Thank you.
Thank you. Now call Bob Doris to be followed by Sarah Boyack.
Thanks, Presiding Officer. I think the Labour Party's attack on universal benefits is deeply ill-judged, and I think it's dangerous, and I'll go on to explain why during my speech. I believe that when Scots realise just how ending universal provision may affect them and their families, but also Scottish society more widely, the people of Scotland will firmly support the retention of universality. I believe that will happen, and I think the false choice that's been presented by the Labour Party today will also be exposed. I stay in Maryhill and represent Glasgow in the Scottish Parliament. And the Maryhill and Springburn constituency, however, would have had an estimated 8,600 constituents paying for medicines if prescription charges still existed. In Glasgow, that number would be nearly 78,000. Is that really the sort of NHS that the people of Glasgow or Scotland want us to return to? And I would say to the Labour MSP sitting in the chamber today, that's 600,000 of their constituents you want to tax when they're not well, and I just don't think that's appropriate. Yes.
Neil Findlay.
Tax. Can I ask where the progressives are within the SNP? Where's the progressives who are arguing against the regressive council tax fees? Where's the progressives who are arguing against a 10% corporation tax cut? Where are they? I don't think you could find a progressive on those benches with a Hubble telescope.
Bob Doris.
I'll look for Neil Findlay's progressive tax agenda when we've all the tax powers restored to this Parliament. I don't want a society where constituents of mine and Neil Findlay's on £16,000 a year have to make a decision between getting medicines or paying household bills. That is no way to support the unwell in Scotland, and no way to run an NHS free at the point of need. And Parkinson's UK, Ms Lamont, please listen to what Parkinson's UK have to say, because they believe prescription charges would be divisive and unfair. They believe it would be a false economy, and they believe it would lead to higher care costs, including hospital and care home admissions. And there's 10,000 people in Scotland living with Parkinson's. I also want to go on to talk about the extension. I want to talk about the extension of theory eye tests. Ms Lamont, thank you. So I want to have a look at that, and we've already heard about the benefits in relation to that from the Cabinet Secretary. 24% increase in eye tests since the extension was given in 2006, an extension that was agreed on a cross-party basis. The Association of Optometrists estimate there's the potential benefit of up to £440 million as eye examinations alert optometrists and ophthalmologists to a number of potentially devastating health problems for individuals, and expensive remedies for our NHS and society are avoided. Eye tests can diagnose diabetes, cancer and tumours, hypertension, stroke and MS, amongst other things. Catching these early, universal provisions to catch these early, make treating such conditions much easier, better for the patient and cheaper for society. The Scottish Government has also built on this with an eye care integration project on eye tests. On eye tests. No, thank you, sit down. The Scottish Government has built on this with the eye care integration project, which began being rolled out in 2010 and will be complete by 2014. And that will lead to 95% of all referrals to ophthalmologists and eye specialists in hospitals being done digitally. And that's important, because that's an example of building service design on universal benefits. And I think that is incredibly important for us to do. But I think the Labour Party position the Labour Party position in Glasgow is confused on universal benefits, because they keep saying nothing is off the table. But I would congratulate the City Council in Glasgow, as SNP councillor John Letford did just recently at the full council meeting, congratulating the Labour administration for its affordable warmth dividend, where they give all pensioners over 80-year-old £100. They don't ask how much money have you got in the bank to that pensioner. They don't ask them what means they have to pay. They just give them the money. On that point, yes?
Joanne Lamont. I agree then with your Minister's decision to means test the central heating programme that used to be universally available to anyone over 60.
Bob Doddis.
I'm glad that you mentioned the central heating programme, which has gone from strength to strength under this Scottish Government. Now, I'd also like to say that's not just Labour councillors in Glasgow, that's also the Deputy Leader of the Labour Party, Anis Sarwar, in Glasgow, also supporting that scheme. So either the Labour Party do agree in universal benefits and the benefit of that provision, or they don't, or they just choose what they believe in for opportunistic reasons. Now, I said that I believe that it was very dangerous what the Labour Party are doing, and I mean that absolutely genuinely, and I've been appealed to the Labour Party here this afternoon. If the Labour Party are not ruling out taking the 600,000 people who benefit from prescriptions by reintroducing those charges, if they want to put at risk the 77,000 people who will eventually benefit from free personal care, whether they want to put at risk the 1.2 million people who get concessionary bus travel, you're alienating people from the welfare state. It is not a something-for-nothing society. People have paid their taxes through their lives, and they actually deserve something back out from the welfare state. So we have the Labour Party talking about a something-for-nothing society, and you've got Ruth Davidson, the Conservatives, talking about people not contributing to society. What you've actually got is a perfect storm to undermine the welfare state, and the first thread that the Labour Party seek to unpick are universal provisions, and that is dangerous, and the SNP and this government will have nothing to do with that.
Thank you. I now call Sarah Boyack to be followed by George Adam.
Presiding Officer, I welcome this debate today because it's a chance to bring into the Chamber the debate Scotland needs to have about the political choices facing us. We've had an SNP government in power since 2007 telling us that things could only be better if we had independence. And that's the politics of the never never. Our job as the opposition is to hold this SNP government to account now, to tell it like it is, to expose the complacency and the assertions that simply don't stack up. Joanne Lamont's amendment is the key challenge to this SNP government. It's about the reality of what's happening to people under SNP rule. We need a reality check. When the SNP put their manifesto out there in 2011, they knew what was coming down the tracks from the Tory government. They knew funds would be tight, and they made promises to people that they are simply not keeping. Nowhere is that more evident than in what's happening in our local councils across the country. Last year's budget choices by the SNP undermined the services which underpin and complement the universal services that this SNP motion talks about. Let's look at the reality of what's happening to bus services. Now, I introduced free travel for the over 60s for buses, so I understand the detail. I'm deeply proud of the principle of free bus travel, and I know it's transformed older people's lives. But that scheme is being undermined by cuts to the bus service operators grant, which has been the last straw for bus companies. Fuel costs are rising, passenger numbers are being hit by the recession, and the funding for concessionary travel is simply not keeping pace with those rising costs. So what is the result? Well, ministers might like to think about it. Fares put up for all bus passengers who don't qualify for the free bus pass. Now, to ministers, that will look like pretty marginal costs. But if you're a hard-pressed bus user with no alternative, that's real hardship. And since the SNP came to power in 2007, bus fares have risen by 19%. And we're seeing services slashed across the country. Last year alone, 136 bus routes axed. And these are the Scottish Traffic Commissioner's figures. Now, that leaves local authorities to pick up the pieces, but given last year's budget cuts, they simply don't have the cash to subsidise all the new services that would be needed. And that's the reality that the SNP ministers don't want to discuss. A proclamation of the benefit of the free bus pass without the inconvenient reality check. And we need to debate these political choices. We need a framework to debate these choices. Our political choices, our passion is driven by fairness, social justice, by the desire to support our communities through these tough economic times. Now, the political argument put by the SNP in this motion today is that all will be well if Scotland was independent. So Scotland will be the only country in Europe to escape any tough choices during this recession. That is simply not credible. No one out there believes that. Yes, I will.
Maureen Watt. Clearly Scotland wouldn't be the only country. Look at Norway with its oil fund and has used its oil fund to cushion against all these economic downturns.
That goes to the heart of this debate. Look at the tax take from the citizens of Norway. Simply not comparable with the low tax regime that the SNP want to impose. Look at the cuts in corporation tax that the SNP want to impose. This adds up, and the SNP are not owning up to it. You've just made my point. Now, the funding for the council tax freeze is simply not enough to offset the straitjacket the SNP have put in place. It's one of the key questions that Professor David Bell, advisor to the Finance Committee, asks us in this Parliament to consider. It's not just the annual cost, it's the cumulative cost. And we are now seeing the results in our communities already. Yes, I'd love to take an intervention from you, Mr MacDonald.
Mark MacDonald.
If all that is true, why did the Labour Party in Stirling cut the council tax?
I was speaking to our council colleagues only the other week in Stirling, and they told me of the mismanagement of the budget by the SNP in that council, which led to overruns in the social care budget. It led to overruns in the social care budget, Mr Alec Neil, by the convener who you have now promoted to give even more responsibility. I think he's now known as the 5 Jobs council member in Stirling. This is an issue about the reality. To the pensioner who came to my surgery on Friday, her problem is that her council tax is in theory frozen. In reality, a minor change to her pension has led to a big council tax hike. And the SNP's council tax freeze does absolutely nothing to protect her and her husband. Our funded council tax freeze was for 2 years. Alec Neil was absolutely wrong to say that we were trying to outbid them. The point about local government funding is it needs to be sustainable, and we need an honest debate about this. It's not just the cuts to bus services, it's the massive cuts to housing budgets, to cuts in social care, and to huge job losses. And that's not just bad news for individuals who won't get access to affordable rented housing or the care they need for their elderly or vulnerable relative or who lose their job. It's bad news for all of our communities. And it's bad economics too. Only today the IPPR called the SNP's economic policy financially illiterate. Bad for social justice, and it means that people are hurting now under the SNP in communities across Scotland. That's why we pushed these issues centre stage in May this year, and people responded by supporting us in greater numbers. There's a headline universal care service for free personal care, but the reality of 15-minute care visits and hikes in costs for care homes and the privatisation of care services. When I met with Unison reps in Edinburgh last month, they told me about the reality of 15-minute care visits where they don't get paid for their journey times, which means they have to make 13 or 14 visits a day, and that's leading to stress. It means a higher level of turnover of staff because of that stress. It's not a well-paid job and there's no career development. That means poor quality services for the most vulnerable of our older people and people with learning disabilities. And that is the cost of the SNP's council tax sleight of hand. And that's why Joanne Lamont is right to say you can't trust the SNP. We need to make sure resources are allocated, that services are fit for purpose, that fit social justice and protecting our communities through these tough economic times. These are our principles. That's why Labour is not scared of this debate. That's why we think it's absolutely essential.
Thank you. I now call George Adams to be followed by Willie Rennie.
Thank you, Presiding Officer. We keep hearing from the Labour Party that they want an honest debate. Well, we had that last year during the election when they decided that they were actually going to do many of the things they've now changed their mind on. They keep talking about their cuts commission that they're currently having. We have a situation here. If I could paraphrase Jerry Rafferty being from Paisley, I've got clowns to the right of me, jokers to the right, here I am stuck in the middle with you. Because effectively, you've got a lot of people here where they actually, with them, they actually sit there. When we look at everything that's happened, this debate is about people. And I have to admit, I'm quite emotionally compromised with this because, as many of you know, my wife Stacey has a long-term condition and she has multiple sclerosis. And when you look at the whole situation, you have to say we've all got family and friends who have suffer from these conditions and have these issues. But this debate is about priorities and what we want for a future Scotland. The debate is about the type of Scotland we want, and I would say free prescriptions, national bus concession card, healthcare, free at point of delivery and free education are core values to the kind of Scotland that I'm wanting for the future. And I think it's something that rings home through with the public as well, because if you look at prescription charges, they were a tax on the ill. It was a case of when you had a long-term condition, many people who were actually involved, Bob Doris was quite correct when he said it was a case of people were deciding whether they paid for their messages or their medication. And that was the situation that happened over and over again. In fact, I can actually tell you, as my time as a councillor in Renfrewshire Council, there was the Renfrewshire Disability Steering Group which I set up, and they are constantly worried at this situation because the Scottish Government is the only people that are actually supporting them, whereas they have the dark cloud of Westminster coming over and the possibility of more cuts. Yes.
Joanne Lamont.
If the member shares the concern of the Auditor-General, who says that the NHS is on an amber warning, that we have £1 billion of backlog to the repairs and that £500 million of that is deemed to be high or significant risk to the services that we would all rely on if we were ill.
George Adam.
Here comes the crux of the argument. We constantly hear things from Labour, but we don't get offered any solution. The SNP stood on protecting the NHS. We have done that. The money stayed there within the National Health Service, and that is the difference where Labour offer absolutely nothing. Now, if we talk about the older people as well, I believe that older people should be looked after dignity and respect as well. In fact, remembering Sunday, we've just had, and I of course did my duty and went to Paisley Cenotaph, spoke to some of the older and not so old soldiers in the area, and they too were discussing some of the issues. The fact that there's a young man who is a Military Cross winner from Paisley, who because of gaining that Military Cross was invalided out, and now he has a bus pass and is able to get about and move his life on. These are real issues for real people, and I think we have to move away from the politics and the academic argument and actually think of the actual individuals that we serve. Look, we're talking about a fairer Scotland, and Duncan McNeill says, how do we pay for it? Well, here's an idea, Mr McNeill. Trident costs £1.245 million. Now, why don't I just decide to go for 29,643 nurses? Or I could go for 34,583 teachers, or 42 to 62 secondary schools. These are the things that we'd rather do within Scotland, rather than spend billions on weapons of mass destruction. Gladly.
Michael McMahon.
Can the member tell us how this money can be spent twice, since Angus Robertson has said all this money will go on defence spending in Scotland?
George Adam.
That's complete nonsense, and I'm glad I had the opportunity to say that on the official record. As I quite said, politics is about priorities, and my priorities are the people of Scotland. You know, we actually sit here in a situation where we've got to wonder where we're moving on in Scotland, and I've mentioned my own personal circumstances once or twice in the past, but I wrote a letter to the Labour Party MSPs within Renfrewshire asking them where they stood in universal benefits. Hold on a second till I finish this situation. I've not had a response from any of them, but I did get one response. One response is that there's a knockabout about politics and where we are. But then Mr Hugh Henry has the audacity to say to me, have you personally benefited from the decisions made by the SNP government? Well, my wife has a long-term conditions, and I think it is a wonderful thing that the SNP have done to look after people like her, and that's where I say it's about people and not about the actual idea of the Labour Party playing politics. I'm proud of the fact that she would do that, she actually gets by every day, and the deal that we have with the Scottish Government. And I find that we're living in a world where you want to come in now, Mr Bibby? You're quite happy? You want to come in earlier?
Neil Bibby.
I think Mr Adams should realise what's happening in the NHS and in his constituency. We've got 2,500 fewer nurses in the NHS, which is affecting the RH in Paisley. We've seen a scandal over lack of blankets and basic materials at the RH in Paisley, a scandal that he denied. And we've seen proposals to close a children's ward in Paisley based on money. Are these a price worth paying, Mr Adams?
George Adams.
I think we actually see the problem with the Labour Party. They would rather play pantomime with people's lives than actually deal with the issues and represent the people that we are elected here to serve. I'm proud to stand on the SNP's record, and I'll quite gladly stand in Paisley when the next election is again and do that again.
Thank you. I now call Willie Rennie to be followed by Fiona MacLeod.
Can I give a bit of advice to George Adams? If he wants to get far within the SNP, he shouldn't accuse Angus Robertson of talking nonsense. And he shouldn't accuse Stuart Stevenson of being a clown. Joanne Lamont and I disagree on much. But I do not doubt her sincerity. I do not doubt that she cares about the future of Scotland. I think almost everybody, and I would say probably everybody, in this Parliament cares about the future of Scotland. So it doesn't serve this debate well for members of the SNP to accuse members of the Labour Party of not caring. It is simply not the case. We're all here because we do care. The big challenges that I think Scotland faces are the things that we should be having at the forefront of our mind. The demographic challenges that Gavin Brown talked about, the 50% increase in the over 60s by 2033, putting huge pressure on our public services. Massive pockets of, not just now, massive pockets of deprivation. Climate change, massive responsibility that we've got. We've already missed our emissions targets. On issues like sustainable growth, coming out of the recession and tackling high unemployment. Poor health. If you look at some of our areas in Scotland, they have about 20 years less good life in them compared with our best-off areas. Now, those are our big challenges, I think, and that's what we should have at the forefront of our mind when we consider these. These are the golden principles. I don't regard universalism as a golden principle. Now, we supported, us in the Labour Party, supported many things like free dental and eye checks, bus travel, tuition fees, personal care. We delivered all of these things. We were the ones that did it. It wasn't the SNP's idea. This was the Liberal Democrats and the Labour Party working together. So we believe in elements of universalism, but it's not the golden principle. If you think it's a golden principle, we shouldn't be charging for any dental treatment. But we do in Scotland. There are charges for dental treatment in Scotland. If the SNP believed in universalism absolutely being a golden principle, we would abolish those charges. We also, they say they want, not just now, they want free education. But if you look at colleges, we charge for courses. So if it's a golden principle, why are they not coming forward with ideas to abolish charges for courses at colleges? They don't. So it's not a golden principle. We have charges for social care. We have charges for residential care. Again, it's not a golden principle. We support elements of it, but it doesn't mean it has to be applied everywhere. Not just now. This is about the return on the investment. That's why the Cabinet Secretary was right about eye checks. I mean, the £70 million investment, the £440 million return. It's a good return for the investment. It's actually improved people's health. People will go and get their eyes checked because they know it's worth the effort. It won't cost them anything. We identify an awful lot more problems. So preventative health is at the centre of that. Free personal care, keeping people in their own homes. It's a good investment, especially with the demographic changes that we've got coming. We've got to find a new way of looking after people because the current models, not just now, the current models of care are really challenging. On tuition fees, despite what we've done down south, I think it improves social mobility. I think people from all sorts of backgrounds are encouraged to go to university. It's a good investment. It's a great return of what we get. If Mark MacDonald wants to come in now.
Mark MacDonald.
Just on the point of demographic change, would Willie Rennie agree that one of the ways that you counter demographic change is by tailoring an immigration policy to attract skilled working-age migrants? And would he not agree that the immigration policies being pursued by the UK government run counter to that and potentially damage Scotland's ability to do that?
Willie Rennie.
We can have a separate debate about immigration, but it's not actually at the centre of this debate. This is about the choices that Scotland faces. It's not about whether the Labour Party have got bad intentions and everybody else has got good intentions. This is about the choices that we make, the return for the investment. And I think what we've had today is actually an admission from the SNP. And the admission is that if they do not win independence, universalism that they have developed with prescription charges and the Labour Party and ourselves developed on other areas goes. That's what they're saying in this motion today, that the only way to secure these things is for the SNP to win in the referendum. Now, what they're saying is, so if they don't win the referendum, these things go. So much for the golden principle of universalism. So we need a little bit more honesty from the SNP. Enter this debate, because it's a debate that's well worth having. And I actually think, for what it's worth, we should be looking to invest in nursery education, because I think the return on investment we can get from investing in 2-year-olds getting 15 hours of nursery education could change their lives forever. I mean, there's studies show that £1 invested now could return £11 later. Now, in England, they're making significant progress. Up to 40% of 2-year-olds, the most impoverished, will get 15 hours of nursery education. I don't hear that from the SNP here, despite repeated requests to do so. That's the kind of investment we should be looking for. It's not whether universalism is right or wrong. It's what return that you get for the investment. Thank you.
Thank you. I now call Fiona MacLeod to be followed by Drew Smith.
Thank you, Presiding Officer. I would like to make my contribution perhaps a bit more reflective than some of the previous contributions to this debate, because I feel that at its heart this debate is about social justice, it's about values, it's about the Scotland we want, and it's about the Scotland we aspire to. In essence, I think this should be a philosophical debate. And I was a bit concerned when I heard from Duncan McNeill the revelations that the Labour Liberal executive for 8 years were only chasing political votes when they made decisions about what benefits they should accrue for the people of Scotland. And I also believe that it's a fundamentally flawed theorem. Certainly.
Duncan McNeill.
Will you promise the Chamber you'll look at the official report tomorrow and give me an apology?
Fiona MacLeod.
Mr McNeill, you clearly said that the Labour Liberal executive brought in a lot of policies because you were chasing votes. That's the expression you used. That's what I wrote down. But to try to be more reflective on this, I do believe that it's a fundamentally flawed theorem that in hard times it is inevitable that there will be harsh cuts. I think it's in hard times that you have to go back to first principles, to what Beveridge talked about, that the duty of individuals to combine as a society with the strong supporting the weak, and that in hard times this is more important than at any other. This has become a debate very much about universalism versus mean testing. I'd rather not, because I am trying to be reflective on the position that we're all in today. There's much evidence on universalism versus means testing. Universalism is less costly to administer. It removes judgment, and I think that is an incredibly important point that has to be got across. We can't possibly go back to the early 20th century when we talk benevolently about the deserving poor. Universalism ensures that judgment is removed and that all are protected from the ills of society. There's a lovely area of research by Corpy and Palm in 1998 called The Paradox of Redistribution. And in that, it's clearly evidenced that in targeting, we are less likely to reduce poverty and inequality. It is universalism that ensures that we work towards the ending of poverty and inequality in our society. And I would say that a welfare system is a normal first-line function of a modern civilised society. That's the modern civilised society that I would like to say that Scotland is now, but I certainly expect it to be after 2014. Certainly.
Sarah Boyack. I think the point is that we're not against universalism, and the SNP government has got rid of universal services like free central heating. The issue is the choice of which, under Alec Neil's watch, you removed free central heating and it's now means tested. The issue is about which services and how those services are defined. If you're being reflective, that's the debate we're trying to have.
Fiona MacLeod.
I think that the Cabinet Secretary clearly has explained that you are not right on the central heating system. But actually, could I return to my debate rather than being sitting on the sidelines watching someone else's debate? Beveridge referred to the 5 great evils: want, disease, ignorance, squalor and idleness. Let's hold firm to the absolute belief that those great evils are there for us to ensure that, as on policy and in practice, we see the end of them. And the only point of controversy that I would I'll raise here, and Bob Doris has already mentioned some quotes, I find it absolutely abhorrent that we have quotes from politicians going back 20-odd years but still being promulgated today. Mrs Thatcher said there was no such thing as society. Joanne Lamont said Scotland was a something-for-nothing society. And Ruth Davidson said that 88% of us in Scotland don't contribute to the economy. I find such statements are an insult to the people of Scotland. They're also anathema to the people of Scotland. That's why the people of Scotland in 2011 voted for the SNP government with its social contract with the people of Scotland. And that's why in 2014 the people of Scotland will vote yes. But, Presiding Officer, can I conclude by saying that perhaps my great desire to see a welfare state that is there to make sure that all are protected is epitomised by my profession as a librarian. Libraries were one of the first and earliest universal benefits for society. Innerpeffray Library was founded in 1680. If we were having a debate today that said that people should have to start to pay to access knowledge through their public library, I would hope that everybody in this chamber would unite against that. And I would hope that everybody, in the end of the day, would unite to support the welfare state in Scotland and continuing in Scotland. Thank you.
Thank you. I now call Drew Smith to be followed by Christine Graham.
Thank you, Presiding Officer. I agree with at least some of what Fiona MacLeod said about universal benefits, but she's wrong to say that the targeting of benefits or the provision of them universally are mutually exclusive. Both are required, and the decisions on which weapon to deploy is tactical. Which will be most effective in this time, with these resources, and to what end? So to my mind, there's something not quite right about our debate on universal benefits this afternoon. Universalism is being pitched as an idea under threat, and targeting is being caricatured. Ideology should never be irrelevant to political debate, but posturing about being the last defenders of universalism is neither helpful nor particularly accurate. In my late teens and early 20s, I used to avoid dentists, and as I got older and slightly more sensible, I opted to return. But I remember after my first visit being asked, "Do you pay for your treatment?" And I confessed, I haven't got any idea whether I pay for my treatment or not. I haven't been since I was a child. And I then confessed further, how much does it cost? And offered up, I could probably afford to. But thanks to the Scottish Government, my confusion about charging for dental treatment has been resolved by the motion in front of us today. The SNP are reinventing universalism, restoring the NHS to the heady days of its foundation. But we know that that's not true. Today we understand that the NHS will cost more next year, but the money available to pay for it will be less. The question is then, what will give? The core of my answer would be a quotation from Nye Bevan, who talked about applying the language of priorities. If resources get even tighter and if the cuts agenda continues, we will have to prioritise on the basis of need. Need has to be the key criterion in the allocation of resources. That's a direct quote from yourself, Cabinet Secretary, given 2 weeks ago at the Health Committee. We will have to prioritise on the basis of need. Need has to be the key criterion in the allocation of resources.
Cabinet Secretary.
I agree about the language of priorities. Does the member agree with me? It's a much higher priority to spend money on our people in education and health and similar services rather than waste billions more on a Trident nuclear defence system that the Labour Party supports along with the Tories.
Drew Smith.
Well, I'm delighted that the Cabinet Secretary has joined the anti-Angus Robertson faction in the SNP government, because the SNP have said quite clearly that the money will be spent on defence, on guns, on soldiers, on all those things in independent Scotland. Presiding Officer, a brief story. Around the time I was elected here, an elderly couple were admitted to hospital where it was determined that they would need long-term care and would not return home. Unfortunately, the husband died within a few days of being discharged after waiting weeks for a care plan to be put in place. The wife fared better, but her daughter was told she should accept a place in a home without the father. Causing a fuss would result in the elderly woman being boarded around the hospital, with the nurse pointedly remarking all the risk of infection that would run. I hear similar stories and complaints about the unfair system of charging and cost-cutting in elderly care at my surgery regularly. We all do. However, in that case, it sticks in my mind because the woman faced with the dilemma was my mum, and the couple languishing in hospital were my grandparents. Given that varying tax is not an option, and we know, in fact, that the SNP, when faced with tax, their immediate response is to try to cut them, this Parliament of ours operates on a budget which is largely fixed. New tax and borrowing powers will begin to change that, but for the moment, we have what we have. We know that we will have less to spend next year than last. Debating whether everything we did yesterday is the way we should do it tomorrow, debating whether every penny of the same money is prioritised to the best effect, that's not cutting. It's doing what we're elected to this place to do. When the history of these years comes to be written, Presiding Officer, it will be asked, when the biggest crisis hit, how did we handle ourselves? How did we work out what really mattered? How did we ensure that it wasn't the most vulnerable that were hit harder than ourselves? The SNP have been given the opportunity few governments get, but which this Parliament was created for, taking the hardest decisions together, debating honestly and on the basis of evidence. I hope that in bringing forward this debate, there is a sign that the Government are willing to begin engaging on both the policies that they trumpet in their motion and the policy areas that they very deliberately ignore. If not, then on the other side of this, people might come to think that the wrong choices were made and the hard decisions were ducked, all to get a referendum answer that never comes. The Auditor-General has NHS Scotland on amber warning, but we know that health is not the only area that should be of concern. Free personal care is universal, but dignity in old age is not. Bus travel is free for 60-year-olds commuting to work, but at the other end of the spectrum, vulnerable 2-year-olds are getting less support than even the Tories can manage down south. Tuition is free for university students, but college kids can get on the bus to look for a place. This is the reality of Scotland out there, Presiding Officer. College budgets cut by a quarter. Local councils introducing charges for services which are relied upon by the vulnerable in our communities. People like Elizabeth, a constituent of mine who lives at Dundas Vale Court in the Cowcaddens area of Glasgow, and she contacted me 2 weeks ago. Each time I have a fall, I'm referred to the Community Falls Prevention Programme, a free NHS service being offered to people aged 65 years and over who have fallen. In 2004, the occupational therapist who assessed my needs recommended installation of a community alarm to enable me to summon help if I needed. I used it for the first time on the 5th of August when I fell at home, broke my arm and gashed my face. I received a letter on the 15th of October announcing the introduction of a charge set at £12 per 4-week period. This service is offered to people, in the words of the service itself, who live alone, are over 65 years and have health issues that make them liable to fall. Liz describes herself and people like her as a captive audience for that charge. In my city, where the poorest of our citizens are still dying earlier, where the most needy are being the hardest hit of all, where efforts we made in the good times we know were not sufficient, when we know that already hard lives, are about to be lived harder, then I feel that the self-congratulation disguised as ideology will do many of the people I represent little good at all, and I support the Labour amendment.
Thank you. I now call Christine Graham to be followed by Jenny Mara.
Thank you, Deputy Presiding Officer. I want to pick up on something Joanne Lamont said about us being in a fixed budget. Of course we are. And we know that in the various portfolios, much of that budget is also fixed. Some 80% is allocated to salaries, transport, buildings and so on, leaving us obviously with 20%, if we can, there to reallocate. Now, my committee has no doubt on others. There's calls for additional spending across the various portfolios, and I'm not wanting the list just now, but I'd say to Joanne Lamont in free debate, add all those commitments together, give us the total bill, and tell us where that is coming from when you see what is being done in the budget debate. I don't want to be in a parliament that pitches college students against university students. No tuition fees, for goodness sake. It benefits those, as I am, from a working-class background. They're often the same people. Yes?
Joanne Lamont.
Christine Graham, when she says she doesn't want to see colleges confronted or competing against universities, her Education Minister is doing precisely that. Because if you're a part-time student, you pay tuition fees, and if you're a college student, you're getting your courses cut. That is the choice your Minister is making. He's making that conflict, and we're asking you to deal with that.
Christine Graham.
I'm going to develop the argument, because we're also being asked here to somehow pitch the elderly free personal care against nursery accessibility, all very laudable. But again, not the arguments I want and think we have to make. And I want to pick up later on Drew Smith's reference to resources. Let me remind Parliament, as I did in an intervention on the Cabinet Secretary, that all those years ago when we introduced free personal care, that saved Westminster, it saved the Treasury to date £300 million. Now just think if there had been justice back from Westminster to this Parliament, how that £300 million could be reapplied to attending to the elderly in their homes with some of the issues that I do recognise from across the other side of the chamber in time spent with elderly, though it's been going on for longer than 4 or 5 years. The council tax fees touched on by others. Now, while some funding for local authority spending is based on property, as it is just now, to get rid of the freeze without having something else in its place based on income and other resources will penalise many, many pensioners who are living in perhaps very large houses, but they are their homes, and that would be a huge disadvantage to them. So it's a broad brushstroke, but in broad terms it is fair, at least, to that group. Concessionary travel for the over 60s. I don't know how Robert Black worked out that £34 million was the cost of those who are travelling who are in work. I didn't know if I switched my card through, which I do very rarely, it can tell who I am. I must investigate that. So I don't know where that figure came from or whether it's just a guesstimate. But it's blinkered. Very blinkered just to see concessionary travel as a travel item. It's a huge health and mental health benefit to the elderly. It takes them out of their isolated existence, out of their cold homes, and my goodness, they're going to get colder. How useless are Ofgem in the winter. It gives them a reason to get dressed up a bit, to go out, to speak to their friends on the buses, or even strangers on buses, to get to somewhere at the other end, have a cup of tea, a scone, and come back and have done something with their day. It is a huge health and mental health benefit. Who shall I pick? Richard.
Dr. Simpson.
Thank you for taking an intervention. No one is denying that. But are you saying that people who are still going to work, like me, who's 70, can have a bus pass and be subsidised by this government and this taxpayer? Because that's what we're arguing. Focus these resources.
Christine Graham.
Oh, we know. For a start, you don't have to use it, Richard. You cannot use it. Or you can put the money in a charity box. But to means test people means two things. It's costly in administration and it makes some people fall out of using it. It's a huge benefit, and I really think, considering in the last run-up to the election you said the SNP were going to get rid of it, it's a bit of a cheek to come up with it now. Now to go on to prescription charges, because I listened to all the evidence on that when I chaired Health and Sport. There is no way you can make a complete list of exemptions that's fair. Can't do it. We had evidence that people were picking which of the prescriptions to take. So it was a very false economy and extremely unjust. It's one of the best things this Parliament has done. Now, means testing, as posited by Labour, creates immediately injustices. We know that. It has never, ever worked for those who fall just out of a category, and it tends to take them out of every other category. You tax at the top. You tax at the top. That's the way to do it. But why across this chamber are all parties not united in attacking the benefits cuts from Westminster? Benefits cuts which will cause misery to many Scots and no doubt lead to increased demands on our health service and our other services, where disabled are being challenged to prove that they're not fraudulent. Take a drop also in the value of the state pension. Something perhaps you don't realise is that the graduated pension, which pensioners paid for over many years, or SERP, state earning related pension, has been frozen. So people who put money in early years to boost their state pension are now seeing that reduced. Their employees' pension schemes are not paying out the way they thought they would pay out. Their savings, because this was not the credit card generation, their savings are being eroded, 0% interest. These are the things we should be looking at. And, of course, we don't control anything to do with these major issues. You know, in conclusion, it's an irony that Scotland resource-rich, but because we can't command those resources, we cannot deliver social justice. And that's really what independence is all about. It's not something pie in the sky. It's not a magic wand, but it does give you the means to deliver social justice. And if we did have that, we wouldn't be standing here, good people in this chamber, making choices of pitching the needy against the more needy. And that's a disgraceful thing to any parliament to have to discuss.
Thank you. I call Jenny Mara to be followed by Maureen Watt.
Presiding Officer, the government motion today is spurious in the extreme. Universal benefits. First introduced by the reforming Liberals in 1908, Campbell Bannerman laid the foundations for the welfare state, the safety net that would catch people when they fell. The great Labour government of 1945 went on to create the modern welfare state, with our finest achievement, the NHS. Presiding Officer, it is disingenuous today to call the spending decisions that Labour has challenged benefits. To take the government's motion today to its logical conclusion, every spending decision this government makes would become a benefit. To fund rehabilitation programmes, a benefit. To fund Scotland's new football academy, a benefit. Pledges never to be challenged or questioned, because they have been enshrined in the immortal language of universal benefits that no man should put asunder. Can we not have a more mature debate? Are we seriously saying that every spending pledge made by this government or this parliament over the last 13 years becomes unchallengeable, not open to scrutiny or tested against the evidence of achievement because it is paid for from the public purse? Do all spending decisions become sacrosanct universal benefits? And if they do, is that really the kind of country we want to run? Is that really the sign of a robust, thoughtful, efficient and effective government? Does it not actually reek of stagnation? Stagnation of thought, imagination and ambition? Because the spending priorities of this government and this parliament are only enablers for work, creativity, business and enterprise that we want to flourish in our country. A health service that focuses its resources on showing people how to take responsibility for their own health and well-being, how to be fit, productive and maintain good mental health. Not a health service that sees fit to pay for my prescription, which I can well afford. An education system that is available for everyone who wants to learn. From blue sky biomedical research to boys who just desperately want to work outside and build houses. But that's not the reality in today's Scotland. In Scotland this summer, some school pupils tried to get into university through the clearing system, but they couldn't because they were Scottish. The same courses listed places for students if they were from the rest of the UK or international. But for Scottish and EU students, there was no room at the inn, because the protection for Scottish and EU students of free tuition fees effectively acted as a cap on places for home students. And who do these places go to? The first people to qualify, to get the grades, to get through the university gates. These first entrants will always come from the more affluent background, those with more support and resources to get qualifying grades at the first sitting, and so they take up the funded places. And what of those who take 2 years, who are in a disrupted classroom, who have little support at home to encourage attainment, who take 2 years to get their qualifications? They go into the clearing system and are refused entry. The sickening but inevitable finding from the Children's Commissioner's big blether across Scotland recently was that children at a young age in our communities say that opportunities go to children from richer families. These were the words that came from our young children's mouths. It is borne out across our system. Take music tuition in Dundee, a campaign that one of our national newspapers has been running recently. In Sidlaw View Primary School, in a deprived area of my home city, 4 children are learning to play a musical instrument. In the richest area, in a similar primary school, 83 children take up the same opportunity. Educational opportunity is not blind, and the children know it. But I don't see the SNP jumping up to make music tuition a universal benefit. A spending priority would be enough for me. And unfortunately for these children, this inequality is replicated throughout the system. Because for those who didn't get a university place through clearing, they might look to wider access schemes. But the Scottish Government pulled the £1 million funding for the award-winning wider access programme at Dundee University just this year. Better spend that money paying tuition fees of those who can afford to make a contribution, because that is where this spurious benefits argument leaves us. And down the road at the college just this summer, thousands, and I mean thousands, of young people on the waiting list for a college place. And today, I checked, there are still over 500 young people waiting for a college place in Dundee. Education is not a universal benefit for them because they can't get in to take advantage of it. And at a time when 25% of young people in Scotland are sitting at home today without a job, is now not the time, the best time, to consider how we redeploy our increasingly limited resources to unlock these young people's potential and by hook or by crook get them into the job market.
Thank you very much. I now call on Maureen Watt to be followed by Dr. Richard Simpson.
In Scotland, we have a proud tradition of universal provision of welfare and public services, which neither discriminate within nor divide among our society. Joanne Lamont asked why we are debating this today. Well, astonishingly, it's because this universality is under threat by Labour. By Labour. Universal benefits like concessionary travel for the elderly, or housing benefit, or job seekers allowance, and, of course, healthcare, exist to ensure the maximum opportunities and quality of life for all, regardless of background or circumstance. It's our responsibility to ensure that people in Scotland continue to have access to the highest quality public services possible, without stigma being attached to those who rely on them. Access to high-quality public services is part of our identity and a large part of what binds us as a society. It's no surprise, then, that the people of Scotland overwhelmingly oppose the UK's ruthless cuts to public services, which threaten to tear our very social fabric and impact upon the poorest in our society. Unstinting protection of public services is at the heart of the Scottish Government and SNP policy. However, this protection goes well beyond frontline services and the importance of how various aspects of universal benefits ensure our health, well-being and quality of life, and that should not be underestimated. Concessionary travel is a perfect example of this. The benefit to 1.2 million elderly or disabled people or veterans who are entitled to concessionary travel does not stop at saving money on their bus fares. People who use concessionary travel, especially those on low incomes, also benefit from improved access to other services in their communities and beyond. This, in turn, facilitates social networking and promotes inclusion for those who might otherwise be isolated, as well as supporting those in work or in voluntary positions. Evidence also suggests that concessionary travel improves the health, well-being and safety of elderly and disabled people by encouraging a more active lifestyle and keeping people engaged in their communities. Ultimately, by contributing towards the broader quality of life of older and disabled people, concessionary travel helps reduce demand for social and healthcare down the line, and therefore supports savings in other parts of the public sector. For example, raising the age of eligibility for concessionary travel to 66 would affect around 40,000 people and save around £8 million in the short term. However, this would most likely result in increased costs being met by NHS bodies for transport to and from medical services, which might otherwise have been met by concessionary travel. The same is true of stringent means testing. The current approach is relatively cheap and simple to administer, since it depends either on proof of age or disability. The fact is, the administration costs associated with any further eligibility checks would be prohibitive, and that would largely cancel out any potential savings. This, to me, underlines the short-sightedness of UK government cuts, which are aimed at cutting back services which are not only vital but also represent good value for the taxpayer. Joanne Lamont asks that we consider this in open and transparent debate. That's exactly what we're doing. What Labour and the Westminster cronies can't get their heads around is preventative spend. That's the choice that this government is making. Choices to intervene early. Just let me finish the point. When we came to office, money was being spent on firefighting, on problems as they arose. This government is trying to prevent the problems arise in the first place. Gavin Brown mentioned free eye tests. Would people go for free eye tests, dental checks, breast screening, bowel cancer screening if we had to pay for it? I think not. I'll take Joanne Lamont.
Joanne Lamont.
Do you think that a 15-minute visit by a carer who's on poorer wages than they were before to somebody that they're not supposed to speak to, they do task and go and then head off, is a price worth paying for a theoretical view of the world that you're presenting? This is not what is happening in our communities. Do you think it's preventative spend for somebody who's isolated and lonely to get a 15-minute care visit?
Maureen Watt.
This is absolutely not theoretical, Ms Lamont. And the issue that you raise is something you should be taking up with the council that's providing that. That's the choice that they make on how they spend the money that they get. Westminster cuts to the welfare system threaten to have similar knock-on effects to our society as a whole, and dismantling the welfare system, Duncan McNeill, is precisely what we're talking about. It's the welfare system in Scotland that we're trying to protect here. And Willie Rennie gets it all wrong when he says this might not last post the referendum. We know that there are more cuts to come from the Westminster government down the line. They have said that, and we have only seen a little bit of the type of cuts that we're going to get from Westminster. One example is, of course, the regressive bedroom tax, which threatens to cut occupants' housing benefit by 14 or 25%, where 1 or 2 bedrooms are deemed unoccupied. And in this context, it even includes where the government think that children could be sharing, seemingly forgetting that children grow up and need single rooms later on in their lives, or whether a person needs an extra room for respiratory equipment if they've got a condition or whatever. As with most UK government cuts, this is likely to hit the poorest in our society the hardest. Housing associations warn it could force more people into homelessness if they can't afford to support a house George Osborne deems to be too big for them or their family. not to mention the unwelcome invasion into family life of roles on which the family members should or should not be sharing bedrooms. The worst part of this is that the UK Government's perceived need for these policies is based on a belief that housing policy can be applied uniformly across the UK. Of course it cannot. I beg to support the Minister's motion.
Thanks very much. Now call on Dr Richard Simpson to be followed by Kevin Stewart.
Thank you, Deputy Presiding Officer. I wonder if anyone in this chamber believes that having a universal benefit has no cost to our system. And does anyone believe that they are, without doubt, to everybody, progressive, benefiting the less well-off? Because if they do, they're not in the real world. In a time of plenty, introducing universal benefits does make sense. The ease of administration, as Fiona MacLeod referred to, the buy-in from everyone. These are all positives that we would all welcome. And it's acknowledged and is acknowledged. But we're not contesting the popularity of these so-called free services, but saying that nothing is truly free. What we in this party believe is that we should have an honest, non-polarised debate of the consequences of the choices this government has made and is going to make. Let me start with free personal care. The report by Lord Sutherland showed us at the beginning of the century that the real problems of the demographic changes, or population time bomb as it's now known. It seemed unfair to me at the time that if one had terminal cancer, then the NHS and hospices provided care free at the point of need. Whereas one had dementia and were not amongst the very poorest, then one had to pay the full costs of residential care. What we now know, however, is that the costs of free personal care were substantially underestimated at that time. Moreover, we should recognise that free personal care actually simply reduces the cost of residential care by about £9,000 per annum. There is still means testing, and the remaining cost for those who come above the threshold is about £24,000 a year. Anyone who reads David Bell's articles on this should follow it with interest. Now, the Welsh chose a different line to us, which actually means there's only a difference of about £70 a week in what they chose to do, and they get the attendance allowance. The government should look at that in the current circumstances and see what the benefits might be. Now, what are the policy consequences? Well, Audit Scotland have shown that the threshold of eligibility for community care has risen steadily over the last 5 years, leaving many for whom preventive and early intervention would be invaluable at the mercy of market forces reliant on their own resources. And as other speakers have said, there are plenty of new community charges have been introduced, while others have risen steeply. And meantime, care staff and third sector staff are having their wages cut in an atrocious way. These are mainly women who are being affected. Where's the equality in that? Where's the social justice in that? Now, what about the NHS? Well, free at the point of need, or more properly paid for, mainly by taxes and partly by co-payment, which exists in every European country. And even in the years of plenty before the Bracking crisis, the SNP didn't eradicate all co-payments. There remained substantial co-payments for dental work and spectacles, for example. Now, Labour introduced, along with the Liberal Democrats, free eye tests. And yes, research has shown it is an effective and worthwhile measure. Not the optometrists who have a vested interest in this, but Aberdeen University, in a properly published, peer-reviewed study, showed that it has a significant effect in saving some from blindness. But I ask you this, and this is another thing about universal benefits. You need to make sure they are focused. So has this government even asked those responsible whether it is necessary to have an annual check-up? Because I've asked them, and the answer is that it is not. We could extend these universal checks to a longer period. Now, these are the sort of questions that we need to ask in applying these benefits. Here we have another possible approach, therefore, to universal benefits in the time of austerity. Keep the benefits free and universal, but examine how effectively they're applied. Bus passes are an example. People who are working getting bus passes seems to me ridiculous. Let us turn to prescriptions. Now, in principle, no one in our party would argue against it. But when faced with the reality of a period of austerity, Labour took the hard decision to reintroduce prescription charges. Hard times, at that time in the 60s, required hard choices and hard decisions. So, Do we have a Scottish Government that have actually done a cost-benefit analysis of prescriptions? No, there is nothing published. The sort of tough decision that we really can't expect of a head-in-the-sand government, an NHS on the amber warning, which they deny, and led by someone I would characterise now as Alex in Wonderland. They are in denial. The recent cuts of 2,300 nursing posts, 180 allied professionals, are bound to affect frontline services adversely, unless, of course, the SNP are saying that all the extra nurses they employed between 2007 and 2011 were actually never needed in the first place. Now, we've lost prescription income of between 50 and 75 million pounds, but this is at a time when waiting time targets are becoming ever more challenging. Every target breach reported is a lowering of professional morale. Lothian, we've just learnt, have had their colorectal cancer targets have come down from 98% to 86%. That is a lot of patients not getting operated on appropriately. And they're going to send 500 patients abroad. And we're sending 8,000 patients to England. It goes on and on. You cannot spend this money twice. Moreover, Scotland used to have the highest level of uptake in innovative drugs of the 4 home nations. Now we have the lowest. And the results of that will be a lessening of our research budget. And in addition, we see the obscene, absurd sight of a National Health Service being faced with local decisions where a new medicine approved for unrestricted use by the Scottish Medicines Consortium is approved in different ways by different local groups, with the patients getting a different approach. This is absurd. And an individual patient treatment request system, which is under increasing criticism. So free prescriptions are not free. They come at a price. No one is suggesting that we go back to the old system, which was outdated and unfair, but we do need to look at whether this is the most effective way to actually spend this money. The SNP promise that an independent Scotland will fulfil all our dreams in a land flowing with milk and honey is simply utopian unreality. Or maybe it's a pot of gold at the end of the rainbow. So perhaps a better image would be that our Health Secretary is the Wizard of Oz, a loud voice behind a curtain, safe until all is revealed.
Thank you very much. I now call on Kevin Stewart to be followed by Patrick Harvey.
Thank you, Presiding Officer. Christine Graham said earlier that we have heard very little today about the dismantling of the welfare state from the government south of the border. And I think that we should look at the impact of Tory welfare cuts and tax changes and how they are affecting the people of Scotland. George Osborne has said that £10 billion of welfare cuts will be necessary by 2016. That's on top of the £18 billion worth of cuts that he is already making, with £2.5 billion of cuts in Scotland alone. The Institute for Fiscal Studies calculate that pensioner households in the UK will be £451 worse off next year. And IFS again say that the average family with children in the UK will be £1,335 worse off this year. We are seeing massive changes to housing benefits, to council tax and to social funds. I'm pleased to say that the Scottish Government is doing something to mitigate some of these cuts. But unfortunately, we do not have the ability with a fixed budget to tackle them all. I certainly will.
Any matter?
That is the case. Will the member explain to me why the SNP forfeited the constitutionally decided tax-varying powers of this Parliament?
Kevin Stewart.
We have not done that at all, Ms Mara. And one of the things which you are just saying here is the opposite of what Ms Davidson said the other week. Obviously now you want to raise income tax, while the Tories want to lower income tax. You know, quite frankly, people are paying enough as it is, Ms Mara, and I think that you are leading folk up the garden path with that nonsensical intervention. Presiding Officer, can I just go back to the point that we are having this discussion about today? We're seeing the dismantling of the welfare state led by a Tory Liberal Westminster government, and what we're hearing from the Labour Party here is a further dismantling of the welfare state and universal benefits as we know it from the Labour Party here. I think that the Labour Party seem to be in cahoots once again with their Tory Liberal partners, and what we have seen is an attack from every quarter on universal benefits and the welfare state. If Joanne Lamont won't listen to what we have got to say in the Chamber today about universal benefits and keeping them as are, maybe she should listen to folk out with this Chamber, some of whom who would normally be supportive of Miss Lamont. Dave Moxham, the Deputy General Secretary of the STUC on BBC Radio Scotland on the 29th of September said, "We're a supporter of universal benefits almost per se. I haven't had a clear argument apart from affordability, and there has not been any principled argument or policy argument as to why they are bad things." He called Joanne Lamont's view on this issue an extreme position. I would agree with Mr Moxham. Lindsay Scott of Age Scotland on the 28th of September said on Radio Scotland, "Means testing has been proven time and time again not to do what it's supposed to do." She noted that respected institutions such as the Institute for Fiscal Studies, the Pensions Policy Institute, the Joseph Rowntree Foundation have all called it unacceptably complicated and stigmatising and expensive. Ros Altman, the Director General of SAGA, in the Times on the 1st of October said, "Extending means testing for pensioners would be a step in the wrong direction. It would be impractical, expensive to administer, and a further disincentive for moderate earners to save for old age. Universal benefits ensure that all those who need money actually get it, rather than allowing pride to get it in the way of them claiming it. The reason why we have all of these additional benefits is because our state pension is so low for so many people. Where to draw the line would be almost impossible to determine." Outside figures who agree with the policies of this Scottish Government. But it's not just outside figures. Lewis MacDonald, I'm just coming to you, said in this Chamber on the 14th of June 2007, "All the parties in the Parliament are committed to making free personal care work. Do Labour really think that abandoning policies like this when times get tough is the right thing to do?" Mr MacDonald.
I'm grateful to Mr Stewart, not least for reminding me of that clear commitment, which I hope he has taken on board too. Can he tell me, in terms of principle, and he referred to principle, on principle, which benefits would Mr Stewart wish to retain as universal benefits, and which would he wish to vary? On principle, what's the difference?
Well, we are dealing with the devolved situation that we are in. We stood in a manifesto. We are discussing a motion today showing our commitment to continue those manifesto commitments. And that is all we can do at present. I wish, Mr MacDonald, that this debate was much wider and that we could discuss all benefits. But unfortunately, we do not yet have those powers. I hope that that day will come sooner rather than later. But while we are in this situation that we are in, I will continue to support the manifesto commitments that we made in the 2011 elections, and to continue the social contract that we made with the Scottish people. I support the motion.
Thank you very much. I now call on Patrick Harvey to be followed by Mark MacDonald.
Thank you, Deputy Presiding Officer. I welcome this debate. There have been good and honest speeches on both sides, from both the Labour and the SNP side. There have also been speeches from both of those parties trying to cast their opponents as the moustache-twirling villains who just don't care. And I don't think that's the kind of debate that we ought to have. I think we can all do better. But perhaps it's the kind of debate that we end up having when this question is cast as one set of cuts versus another set of cuts, with each side blaming the other for the social consequences, for the undermining of health or dignity or well-being that each side's set of cuts creates. I support the government when it makes a clear commitment to the value of universal benefits and services. We've heard many of the specific examples today. And I support the Labour Party when they bring a critique about the consequences of spending priorities and make it clear that a circle can't be squared, that we can't have Scandinavian levels of public services and pay American levels of taxation. Both sides are right in those positions. Now, some of us would cut the universal services and benefits. Others would raise the taxation. But the choice can't be avoided. And the choice also can't be answered just by saying Trident, Trident, Trident. My commitment to disarmament is, I hope, clear to everyone. But in a moment I will. My commitment to disarmament is clear to everyone. But even if it wasn't for Angus Robertson's dream of a £2.5 billion annual Scottish defence budget, Trident in itself won't fill every financial hole. Mr. Stewart.
Thank Mr Harvey for giving way, Presiding Officer. Would Mr Harvey agree with me that one of the ways of stopping some of the cuts that we're seeing from Westminster would be for the closure of tax loopholes, including tax loopholes which allow multinational companies to avoid taxation, as we've seen in recent weeks?
I agree very much indeed. I agree very much indeed, and I hope that he'll agree with my call on Mr Swinney to prevent those same tax-avoiding companies from benefiting from schemes like the Regional Selective Assistance Grants here in Scotland. There was an early exchange between Alex Neil and Joanne Lamont at the beginning of the debate about the relationship between taxation and services. And I think Alex Neil responded to that criticism by saying, well, Labour, you supported the council tax freeze as well, so how dare you criticise it now? Well, there were some of us who did say before the last election that the council tax freeze was unsustainable, and the question must still be answered by the government. If the council tax freeze continues unabated, if the government continues with its policy of sticking with council tax despite its unprecedented majority in the chamber and get the opportunity to replace it with something fairer, and if they come to the next election with whatever range of powers we have committing to cuts in corporation tax as well, the services and benefits will suffer as a consequence of those policies. So while there's very little in the government's motion that I disagree with, I did lodge an amendment, Deputy Presiding Officer, to delete the end of it, because the only way to protect these public services and these universal benefits is not independence. I'll be voting and campaigning for a yes vote in the referendum because I think it offers more opportunity than risk, but it offers no guarantee. The way to protect these services and benefits is to raise taxation from those who are able to pay. There's not much I disagree with either in the Labour amendment. My only regret, really, is the lack of a clear position. Towards the end it says, take action, but it doesn't specify what action. Duncan McNeill's speech, one of the most serious in today's debate, I thought, still had no clear prescription. It got closer than most, though. It got closer than most. It kept saying, we must get this right. And then Mr McNeill used the phrase, planned disinvestment. Planned disinvestment. That contrasted with Sarah Boyack later in the debate, who made the critique about the SNP talking about Norway and comparisons with Norway without being honest about Norwegian levels of taxation. Well, we need to be honest about both, and we need to stop talking about this debate in terms of a fixed budget. We could right now, even with existing powers under the current devolution settlement, empower our local councils to raise taxation in progressive ways. We could do that right now if we only had the political will. And we would make that comparison with a country like Norway more accurately. A country where the biggest part of your individual personal taxes go to your local community, and then a share to the regional government, and then a smaller share to central government. We could be making a change in that direction right now. I won't be supporting the Conservative amendment either, Deputy Presiding Officer, always with the Conservatives a focus on the costs, not the value of the public sector, of public services, of universal benefits. Why is there no call for a long-term estimate of the cost of business support services or grants to the private sector from the Scottish budget? Why no call for a long-term assessment on the value, dubious though it is, of the small business bonus, or a long-term estimate of the inequality between rich and poor in our society and the poverty impact of the UK government's welfare cuts, or a long-term assessment, indeed, of the scale of tax avoidance by the wealthiest in our society. Deputy Presiding Officer, in closing, the phrases something for nothing and free services have riddled this debate. We do need to be honest that free services are not free. They are only paid for on a collective basis. We choose to do that where we make a judgment that our society is better off collectively when we pay for them in that way. But it doesn't happen except by the raising of taxation from those most able to pay, and that should be where this debate takes us.
Thank you very much. I now call on Mark MacDonald, after which we'll move to the closing speeches.
Thank you very much, Presiding Officer. While I was offering interventions during this debate, I was struck by the notion that it appears nobody seems to take me seriously anymore. Luckily, I don't either, so I was not really offended by that. I would listen to what Patrick Harvey said there. I think when we talk about free services, we're talking about them being free to access, rather than free in terms of the cost of delivery. And I absolutely agree with his point around the collectivism issue that lies behind those services. But today's debate it would be okay if we were just talking about it in purely esoteric terms, but I think we also need to do it in terms of looking at real people. So let's look at the 62-year-old woman who acts as a carer for her disabled husband, who is 66. While doing so, she also works in the local supermarket. She is in work, but qualifies for and receives a free bus pass as a result of her being over the age of 60. This helps her get to and from work. It also enables her and her husband to use the bus in order to go around Scotland for holidays, to go into town to access leisure pursuits. This also helps to reduce her outgoings, because if she were not eligible for the free bus pass, she would have to pay to use the bus instead, and that would be something that she would have to weigh up within her weekly budget. She and her husband both require a variety of medications. Thanks to free prescriptions, they don't have to worry about rationing their medication, which they previously had to do before prescriptions were made free. They also see the benefits of free personal care. Now, I note that an individual example or individual examples are now to be used to define the norm. I think that's always dangerous when looking at free personal care. There are many people who I speak to who see benefits directly delivered to them as a result of free personal care. Where there are difficulties, and I have come across them, often these are the result either of local decision-making process or of the practices of particular private contractors and their staffing arrangements. And it's for individual members to take those issues up with local authorities rather than to simply suggest that it relates to the general principle or indeed the way in which central government allocates funding to local authorities. I'll give way to Mr Malik.
Hanzala Malik.
Thank you very much. Just to reaffirm that I take every member in this chamber very seriously, including yourself. I don't want you to think for a minute that we don't. However, I am disappointed with the lack of interest from the SNP in this very important debate. I'm seriously disappointed. I think this is very important, and I think some people have not taken interventions, and that's a shame. We're here to do a job. We're here to represent our people to the best of our ability. When we do this, we fail them. But I also want to make a point, and that is, I, for example, am a patient of diabetes. I am actually now with failing sight, sir. And rather than treat me, I've been given another appointment to come back in a year's time. I wonder why.
Mark MacDonald.
Well, I take what Mr Malik says. I would firstly say that by admitting he takes me seriously, he's probably guaranteed he won't ever go anywhere in the Labour Party. But on the point he makes about individuals not taking seriously, I'm not going to speak for where other members from other parties are in terms of their commitments. I think it would be wrong for me to do so, but I do know that that my colleagues are very much committed to the agenda that is at hand. I think the point that Mr Malik was making around his hospital waiting time, I see my Glasgow colleague Mr Doris to the side of me as one of Mr Malik's MSPs. I'm sure he'll be happy to meet with him as a constituent and discuss the matter further in some detail, but I don't think it relates to the issue which we're dealing with here at hand. The couple who I was speaking about, constituents of mine, they also, if I could make some progress, Mr Finlay, the couple I mentioned also benefit from the council tax freeze, and the point which I had sought to make and which Ms Lamont chose, as is her right, to misrepresent, is that as a proportion of income, this particular couple and their household, and indeed other low-income households, benefit disproportionately by comparison to higher income households as a result of the council tax freeze. They save more as a proportion of their income than other higher income households do as a proportion of their income, particularly within the same council tax banding. To look at the issue of tuition fees, the NUS have sent us a briefing where they remind us that in 2011 all Labour MSPs, SNP MSPs, Liberal Democrat MSPs and indeed Green MSPs signed up to a pledge stating that they would not introduce tuition fees in Scotland. The Tories didn't sign up to that pledge, but then we know what their views on the matter are. But the argument was made from the Labour benches today that we knew tough choices were on the horizon, that somehow the SNP did not see these things coming. Well, if that's the case, then neither did those Labour MSPs who signed up to that pledge, yet now are telling us that tuition fees, that free tuition at universities is something that needs to be reviewed. They should have thought about that, perhaps, when signing the pledge. Indeed, the NUS Scotland briefing states quite clearly that a move away from universality of undergraduate education would be an incredibly regressive step, and also states that one of the benefits in terms of protecting progression opportunities for Scotland's college students, because we should remember that many of Scotland's college students then go on to university education. But the extension of logic that is being put forward here, that somehow your income dictates the services to which you are entitled to access, would perhaps lead one to assume, I'm sorry, I'm in my last 10 seconds, would perhaps lead one to assume, therefore, that individuals of high incomes... OK, no, that's fine, yep.
Thank you.
I wonder can you explain to me how somebody progresses from college to university education if they can't access a place in the college because of the cuts of your government?
Mark MacDonald.
One would assume, Presiding Officer, that if the choice that Joanne Lamont is seeking to advocate here, that it is between free university tuition or college education, then NUS would be full square behind her as defenders both of college education and of university education. But they're not calling for the government to make that choice. They see it and recognise it as a false choice being put forward by the Labour Party. But the extension of logic, if we were to take the logic being put forward by the Labour Party and extrapolate it, then those above a certain income ought to send their children to private school or ought to take out private healthcare insurance rather than to mooch off the state. But we recognise in our society that certain benefits deliver on a universal basis. People pay in taxation on the basis of their income, and therefore they are entitled to receive something back as a result of that, irrespective of their income. It also removes stigmatisation, because one of the things which one of my constituents said to me was, before, when I went to the chemist and I was standing in the chemist receiving my prescription for free while others around me were paying for theirs, it marked me out as somebody who was on a low income, and I felt stigmatised as a result of that. That is the feeling that many people had when they were receiving free prescriptions while others were having to pay for theirs. By removing the need for people to pay for their prescriptions, we remove that feeling of stigmatisation, that feeling of a divide in Scottish society, and everybody benefits.
Thanks very much. Thank you. Now call on Murdo Fraser. 7 minutes or thereby, please.
Well, thank you, Presiding Officer. This has been a rerun of a debate we had a few weeks ago. And the very fact that the SNP scheduled this rerun debate tells us, I think, two things. First of all, it tells us that Joanne Lamont, and credit to her for this, has got under the SNP's skin on this particular issue. And the second thing it has told us, Presiding Officer, is that in that first debate 5 weeks ago, the SNP took a hammering. And they've had to come back on the pitch today and try to redress the balance. The home team were 3-0 down at half-time. They've limped back on the pitch, but this time without the star striker who disappointed so much in the last debate. The Deputy First Minister has been left in the dressing room. Instead, who comes on but the super sub? Well, the sub, anyway, Presiding Officer. The new shiny Health Secretary, Alec Neil, the man who, for Aberdeen Football Club fans of a certain vintage, will be recognised as the John Hewitt of the SNP cabinet, coming on, getting the ball, dribbling it up the pitch and blutering it over the bar. Because we have heard nothing from the SNP in this debate, from Mr Neil or anybody else. There were no arguments put forward that we did not hear 5 weeks ago. And I struggle to hear a single SNP contributor come up with a new angle compared to what we heard 5 weeks ago, with just two exceptions, one of which is the Cabinet Secretary himself, who told us, and I wrote this down because it was so interesting, the answer was higher taxes. We've not enough money, we're going to put up taxes. We can check the official report. And the second, and I wrote this down as well, was from Mr Doris, who told us that since the means testing of the central heating scheme introduced by the SNP government, that scheme had gone, and I quote, from strength to strength. So there we go. From the SNP backbenches, the way you improve public services is to bring in means testing. Presiding Officer, let's deconstruct, if we can, the SNP motion, because they present universality as a matter of principle. This is clearly incorrect. Willie Rennie and others made this point perfectly fairly, because there are whole aspects, even within the NHS, there are whole aspects where people already are having to make contributions, whether that's in terms of dental treatment, whether that's in terms of optical charges. People might get free eye tests, but when they need glasses or contact lenses, they have to meet a proportion of the cost themselves, and that contribution is means tested. The same applies in audiology and elsewhere. And at the same time as the SNP are telling us about universality, they are bringing in means testing. They've already done it in the central heating scheme, and right as we speak, Presiding Officer, I'll give way in a second. Right as we speak, Presiding Officer, the Cabinet Secretary for Justice is extending means testing in the legal aid budget. So this is not a matter of principle, it's a question of where you draw the line. As I mentioned them, I'll give way to Mr Doris.
Well, I thought it might be important. I was going to let you with one inaccuracy, but I may as well correct it since I've said it twice. The Central Heating Programme had eligibility extended and is now called the Energy Assistance Package and does continue to go to central strength. Other than means testing, what we have done is widen criteria.
I have to say to Mr Doris, I'd have to check the record, but I distinctly remember Mr Neil, when he was the Housing Minister, saying something along the lines of the right approach was to target resources better at those most in need. That is the way it was approached. Abandon universality and target most in need. And the Minister can correct me if I have misinterpreted what he had to say. Oh yes, please.
Mr Neil.
There are so many facts he's got wrong, I don't know where to start. First of all, the central heating programme was not universally available. It was only available to a certain number of people. Factually wrong. What we did was extend the programme to many more people in the same way that we extended the free bus passes to disabled veterans. Are the Tories against that as well?
So you targeted the resources at those most in need. That's exactly what I thought you had said, Presiding Officer. Now, this is all about choices, because we know if we bring in free prescriptions for people like me who can afford to pay for them, that will have an impact elsewhere on the NHS. That's a point made by Audit Scotland. It's a point made by the First Minister's hand-picked Chief Economic Advisor, Crawford Beveridge, in the report he prepared for the SNP. It's a point that's been made by Professor Charlie Jeffrey in a report for Age Scotland. It's a point that's been made by the British Medical Association. That is the point. It's all about choices. But the most laughable part of the motion, and it's so laughable that the Cabinet Secretary made very little attempt actually to defend it, is the one that says the only way you can protect universal benefits is to vote for independence. And I heard nothing. No, I need to explain this point. If there's time, I'll let you come in. And I didn't hear a single SNP backbencher explain the link between the two. It is an extraordinary non sequitur. And even Patrick Harvey, that leading light in the Yes campaign, accepted that was the case. As Gavin Brown fairly said, the demographic challenges that will face us regardless of the constitutional future we choose, unless the SNP have something up their sleeve they haven't told us about. Because if we became independent, of course, it would depend who was elected in power at that particular time, the choices that would make. So the SNP telling us they would be in power forever in an independent Scotland. Would the First Minister go on and on and on and on like a Scottish version of Robert Mugabe or Fidel Castro? I see that dismays the SNP benches as much as it dismays the rest of us. No, Presiding Officer, we need, as our amendment says, a fully informed and measured debate on the subject of universal services. A call we make in our amendment a call echoed today in their briefing for this debate by the Royal College of Nursing. And to inform this debate, we are calling on the Scottish Government to publish forecasts for spending on universal services in Scotland for each of the next 10 years. What could be fairer than that? What a reasonable request that is, so we know where we're going. Whether we are independent or not, we know what the challenges are. I hope in winding up, the Minister will agree to accept that amendment and agree to that very reasonable request. That is the way we progress this debate, Presiding Officer, not on a ridiculous proposal in a ridiculous motion from an increasingly ridiculous government.
Many thanks. Now call on Jackie Bailey. 9 minutes or thereby.
Presiding Officer, the economic forecast remains bleak, unemployment is rising, and it remains persistently above the level in the rest of the UK. There are 30,000 fewer public sector workers, and our public services are under enormous strain. And I don't say that to talk Scotland down. It is about recognising the reality of the situation that is being faced in communities across Scotland. And can I, with all due respect, say to Fiona MacLeod, you cannot consider this issue in the abstract when people are struggling now. Now, over the next few years, experts tell us that our budget will fall by £5.5 billion. The SNP know that, we all know that, and yet they've only managed to identify savings of about 25% of what is actually required. Now, it doesn't take a genius to work out that, therefore, 3/4 of the cuts are still to come. The truth is, Presiding Officer, that the SNP don't want to tell you how bad it is before their referendum. The truth is, their sole concern is securing independence, and they give it away in their motion. Do the SNP really care about the pensioners struggling to heat their home this winter as energy prices rocket? Do the SNP really care about the hard-working families having to rely on food banks to feed their children? And do they really care about the increasing numbers of young people out of work and on the dole? And I actually genuinely say to Patrick Harvey, I think he's right, it's not about who cares the most in this issue. But he is equally right when he says you just cannot hang around for 2 years, wait for independence, which will be wonderful, say the SNP, but do nothing now for the pensioners, the hard-working families, the young people who are struggling, and you are not helping. I give way to Patrick Harvey.
Patrick Harvey.
I'm grateful to Jackie Bailey for giving way. I agree that the government shouldn't be waiting till the referendum to make some of those changes, such as empowering councils to raise revenue progressively. But we shouldn't wait for the Labour Party either. The Labour Party also must say what is the balance it wishes to strike between raising taxation and making a different set of cuts than the SNP is making.
The debate we want to have in this chamber across party to ensure that, dearie me, Presiding Officer, you can tell that it is indeed Christmas. They're getting noisy. The SNP today have sent out the government's very own pantomime dame, Alex Neil, and he is as ever rising to the occasion. Famous for not letting the facts stand in the way of a good story, his Orwellian doublespeak today is truly the stuff of legend. But, you know, there was one interesting thing today, and I think Murdo Fraser is right. Alex Neil is in favour of higher taxes. The First Minister is in favour of lower taxes. Who indeed is right? Now, I have to say, Presiding Officer, I know you will find this hard to believe, but I have accused the government in the past of being more interested in division and in denial. But, you know, they keep presenting me with new evidence to support that contention. Let me tell you a story about the Cabinet Secretary for Health. In the Airdrie and Coatbridge Advertiser that I've taken to reading quite avidly, of the 17th of October, our very own Alex Neil appears in a story, a serious story, about a pensioner having to have her leg amputated because of a failure to diagnose the problem early enough. Now, that is clearly very distressing for her and her family. So how helpful is it that her MSP is none other than the Health Secretary? And does the Health Secretary take responsibility, help to sort this out? No. We understand from the article that he's written to the Prime Minister. Now, Presiding Officer, health has been devolved for the last 13 years. The responsibility lies with none other than Alex Neil.
Alex Neil.
I just, for the record, state that the article was wrong in that respect.
Well, I'm delighted to hear it, because meanwhile, out in the real world, Families are squaring up to that economic challenge. They're looking at what they need rather than what they want. And it is time that this government did the same. We need an honest debate. We need to be explicit about the choices that we make, and we shouldn't let things happen by default. Cuts are being made now by the SNP, yet you even deny that. But the doctors know it, the nurses know it, the home care staff know it, the man and woman in the street know it. And at the heart of this debate is an issue about fairness. You can't just simply suggest it's universal services versus some kind of targeted provision, because the issue is far more complex than that. And you do people a disservice by pretending otherwise. Most mature countries have a mix of universal and targeted social policies. And I don't disagree with much of the analysis about some of the benefits gained, but we need to make sure that these policies are properly costed and that they don't have unintended consequences. The NHS, as we know, largely functions as a universal service. Free at the point of need, everyone receives a service, and we absolutely support that. But there are parts of it that are not universal. NHS dental treatment is means-tested. Optical vouchers for people to get their glasses are means-tested. Travel to hospitals, means-tested. Indeed, the system for dental treatment and optical vouchers is exactly the same as the old system for prescriptions. The SNP say that reintroducing any element of prescription charges is a tax on ill health. So let me ask the Cabinet Secretary right now, does he believe that the current means testing for NHS dental treatment and optical vouchers are a tax on bad teeth and poor vision? Oh, the Cabinet Secretary isn't standing, my goodness. I take it from his silence that, we're not seeing policy made on the hoof. It is a tax on bad teeth and poor vision. But then, of course, let's just be more serious, because there are a whole range of home care services and residential care services, all of them being means tested. Let me turn to social care. And can I say genuinely to Maureen Watt, the SNP are not protecting public services, which was the contention in her speech. Just look at what's going on in local government. Shouldering the burden of the SNP cuts, 83% of the Scottish Government's budget cuts passed on to those in local government, the very people we expect to deliver on the increasing demand for social care. For the first time, people are paying for essential services such as home helps, community alarms, aids and equipment for the disabled. Costs have risen by as much as 50% in the past few years. And there is a postcode lottery of care. Different charges, different eligibility criteria, a system of rationing that sees 15-minute care visits as somehow ticking the box. That isn't about fairness. That's the consequences of the choices made by the SNP. Let me turn to free prescriptions, because the cost of making free prescriptions free was £57 million last year, and the cost is projected to rise to £61 million next year. That's enough to pay for the salary of 2,000 nurses. That's the choice. Bob Doris said you can have free prescriptions, and that helps people in poorer communities as well. But tell me something, Bob. What do the SNP tell people when they are refused life-saving cancer drugs because of their own cuts? The truth is that the choice that the SNP make is not to fund cancer drugs. It's to remove 2,500 nurses and midwives from the NHS, taking their numbers to a 7-year low. The truth is that the choice the SNP make is to provide an advantage for people such as Fred Goodwin, bankers, the lot of them, when food banks are appearing in our towns and cities. The truth is that the choice the SNP make is that older people are cut off from essential services because they cannot afford to pay, and the SNP cuts to local government are making them worse. Add to that, presiding officer, the backlog of maintenance in the NHS amounting to £1 billion. The SNP need to realise that the time for soundbite policies and retail politics is over. It is time for you to be honest and truthful. This isn't just a debate that Labour are calling for. Why don't you listen to the BMA, the RCN, Audit Scotland, when they express their concerns about the health service? Or, for that matter, Campbell Christie, Crawford Beveridge, Professor David Bell about the sustainability of services. Presiding officer, this is a debate about the SNP's myth versus everybody else's reality. And can I, in closing, continue with my Christmas theme and leave you with the words of three wise men? Mike Russell, in writing and probably recorded, said, put bluntly, universality now drags down both the quality of service to those most in need. Kenny McCaskill to the Justice Committee said, it is right that those who can afford to pay towards the cost of their defence should do so. And none other than Alex Neil, in this chamber, on the 15th of May 2009, when speaking about the changes to the central heating programme, said it would be inappropriate to use scarce resources to provide free central heating systems for some of our retired bankers. Presiding Officer, the SNP must stop pretending.
I now call on Michael Matheson. You have until 5 o'clock, Minister.
Thank you, Presiding Officer. This has been an interesting debate. Yes, there have been some reruns from the last debate, but one thing that has been clear, that in the time that's less than we've had since the last debate to this debate, Labour still haven't come up with a single policy in the area of universal benefits. And universal benefits are often viewed as being the touchstone of a progressive society and the progressive policy that would be taken forward by any given government. They're often viewed as well as the type of touchstone issues that reflect how progressive a parliament within a country is, and it also sets out how we want to define the society that we all choose to live in. About creating a society which I know some on that side don't believe in, but one which is about creating a fair and just society for all. What I do regret those who like to talk about universal benefits as though it's something for nothing. It is certainly not something for nothing, because people who get these universal benefits have often paid their tax and worked hard in order to get the benefits that come from them. But it's also correct that when we do look at the issue of universal benefits, that we have to reflect upon them within the financial climate that was created by the disaster started under the Labour Party and continued under the Tories and Lib Dems in Westminster. The way in which they have ravaged public service spending by the cuts that they have imposed in the Scottish Government's budget and in public service budgets in England as well. But it's also right that when we look at this particular issue, that we do so in the way that Gavin Brown also recognised, that not only do we have the financial constraints in which we are operating, but we also have to look at the demographic shift that we face as a society. People are living longer, which is great, and more people are living with long-term conditions. But that's not about deciding on whether we should get rid of universal benefits or not. That's about looking at how we can support people with long-term conditions much more effectively in the community, and what we can do to prevent long-term conditions in the future as well. And Gavin Brown made reference to the free eye test. Now, you'll be aware that the free eye test is much more than just an eye test. It's an eye health test. And we've had evidence that suggests that some £40 million of benefit is gained from the preventative benefits that come from that free eye health check. That's a very good example of making an investment now to get the benefits of it in the future, and the preventative spend that this government has made a commitment to doing to make sure that we've got the right policies in place to serve us in the future. I want to turn now, though, to the issue of prescription charges. I'll give way to Gavin Brown.
Should the medium-term forecasts for expenditure on universal services be published or hidden?
Michael Matheson. In the last debate, John Swinney set out very clearly how we will take forward our spending commitment on universal benefits. But what we have made very clear is that preventative spend is a key part to making sure that we have sustainability in our public finances in Scotland. And John Swinney is taking that forward for the first time in this Parliament in 13 years. People question, why did you abolish prescription charges? Some accuse us of being nothing more than just being a fig leaf to the electorate. Now we had at one point support from the Labour Party. The Labour Party have now abandoned the whole idea of free prescriptions. Let me tell you why. Have a seat, Richard Simpson, because I'm coming to you. Let me just tell you why we abolished free prescription charges. Because there were 600,000 people in Scotland on a yearly income of less than £16,000 who found themselves having to pay for their prescriptions, having to worry about what they could afford, whether they could take all of the items or they could only take some of those items. And we decided it was much fairer and much juster to abolish prescription charges for everyone in Scotland. Now we know that the Labour Party have abandoned... Have a seat just now, Richard Simpson.
Sit down.
Now we know that the Labour Party have abandoned free prescriptions for the people of Scotland. But I also want to turn to the issue that's often referred to of free personal care and free nursing care, often referred to as one of those touchstone policies of this Parliament. Now, some of us have been here long enough to remember that Labour were not united at the time of free nursing care for elderly. Great division within the Labour Party over it. But it's a policy that some 77,000 older people in this country benefit from on a day-in, day-out basis. I'm proud that I supported a policy that allows those 77,000 people to benefit from that on a daily basis. Now, I recognise that there are some of those in the Labour benches who also support universal benefits. Some of them support the provision of free personal care. Some of them at one point supported the provision of free eye checks. Some of them at one point even supported free bus passes. And some of them at one point even supported free prescription charges. So after today's debate and the debate we had a couple of weeks ago, I'm none the wiser where Labour now stand on their debate that they're locked into in the something-for-nothing culture. I don't know whether in Labour's view the something-for-nothing culture is the elderly person that benefits from free personal care. I don't know if Labour's view is that they no longer support something for nothing and free eye checks. I don't know if Labour's view is that the veteran who benefits from the free bus pass is getting something for nothing. And I don't know whether they view that the 600,000 people in Scotland that benefit from free prescription charges are the culture of something for nothing. But what you can be assured of, and Joanne Lamont asked for it, let's have some honesty in this debate. Well, I'll give you some honesty in this debate. Honesty in this debate is that we support free prescription charges, the free bus pass, free personal care for the elderly. The honesty that's not in this debate is what the Labour Party's position is on these important issues. And when Joanne Lamont, I'll give way to Joanne Lamont to see how she can make amends.
Does the Minister believe that free personal care is properly funded and fully funded? And if so, why are people across the country getting 15-minute visits and care workers are getting their terms and conditions reduced? Minister?
So we go back to that old chestnut, the chestnut of people getting 15 minutes of home care. You know what's always interesting about Joanne Lamont about this is she wants to define it on, it's either free personal care or people getting more time from the carers coming into their home. What she chooses not to make reference to is the £300 million of attendance allowance that's been denied to the Scottish Government by the UK Government that was cut when they introduced it. And Joanne Lamont's been in this Parliament long enough to recall that Henry McLeish, when he was First Minister, made it very clear that he was unhappy at the response he got from the UK Government and was continued by Alistair Darling. That's £300 million we could be investing in our elderly services in Scotland if we had access to that resource. And when Richard Simpson questions the provision of free prescriptions in Scotland, did he ever consider the £91 million it now costs us on an annual basis to pay for the PFEI deals that were signed under Labour in Scotland? Money that could be better used for our NHS and investing in public services. I'll give way to Richard Simpson.
Richard Simpson. Let's have a little reality in this debate. Will you accept that you still actually conduct means testing for some prescriptions? And I'll tell you which prescriptions, the minor ailment scheme. The same system of means testing as before. So let's have some reality. You are means testing for many, many things.
Presiding Officer, Richard Simpson talks about some reality, and just over a year ago, Richard Simpson stood in a manifesto committed to these policies which he now wants to get rid of. That's a reality that people in Scotland recognise. A Labour Party they can't trust to stand up for the needy and to create a socially just society. But, in drawing my remarks to a close, Presiding Officer, this is a debate which is much more than setting the needy against the needy that some may wish to set it as. We don't accept the confines of this debate, a debate which is set within the limited vision of the Westminster budget. This is about being able to make decisions for ourselves, about creating the society that we want to create here in Scotland, one which is about a socially just Scotland and a fair Scotland, a provision of services where people can rightly know that they'll be there in their time of need. We are not here to simply manage the Tory cuts for the people of Scotland. We have a vision that goes beyond the Westminster system. It's only sad that we have a Labour Party now that wants to throw out social justice in its desperation to try and create some meaning for itself. But as a society, the people of Scotland can be sure that the Scottish Government will remain committed to delivering a socially just and fair Scotland.
That concludes the debate on universal benefits. Order. There are 3 questions to be put as a result of today's business. The first question is amendment number 4778.4 in the name of Joanne Lamont, which seeks to amend motion number 4778 in the name of Alex Neil on universal benefits. Be agreed to. Are we all agreed? No. The Parliament is not agreed. We move to a vote. Members should cast their votes now. The result of the vote on amendment number 4778.4 in the name of Joanne Lamont is as follows. Yes, 40. No, 61. There were 12 abstentions. The amendment is therefore not agreed to. The next question is amendment number 4778.3 in the name of Gavin Brown, which seeks to amend motion number 4778 in the name of Alex Neil on universal benefits. Be agreed to. Are we all agreed? No. The Parliament is not agreed, therefore we'll move to a vote. Members should cast their votes now. The result of the vote on amendment number 4778.3 in the name of Gavin Brown is as follows. Yes, 15. No, 98. There were no abstentions. The amendment is therefore not agreed to. The next question is that motion number 4778 in the name of Alex Neil on universal benefits be agreed to. Are we all agreed? The Parliament is not agreed, therefore we'll move to a vote. Members should cast their votes now. The result of the vote on motion number 4778 in the name of Alex Neil is as follows. Yes, 61. No, 52. There were no abstentions. The motion is therefore agreed to. That concludes decision time. We now move to members' business. Members who leave the chamber should do so quickly and quietly.